25 who will be joining through the web link. We are already giving YouTube live streaming, and because we have an anatomy YouTube channel and we have linked to that, and we will be giving access through that Build Body program, Gannavaram, AP, India. That is the YouTube channel. So it will be live streamed on that YouTube channel. And even those who are not registered can all view through the live streaming of YouTube channel. So it is for infinite number of participants, not just who have registered. For those who have registered, they will join through the Zoom link. And for those who are not registered, they'll see the YouTube live stream. So it's 10 a.m. So we will start.
Good morning to all of you, all the respected dignitaries and our speakers and the participants. On behalf of entire organizing committee for this international webinar series, myself, Dr. M.P.S. Tomar, is welcoming you all. And now I would like to invite Dr. P.V.S. Kishore, the organizing secretary for this webinar series, to take over the proceeding further. Sir.
Thank you, Dr. Tomar. Good morning and a warm welcome to all viewers. On behalf of the Sri Venkateswara Veterinary University at Tirupati in the state of Andhra Pradesh in India, being a constituent college of the university, we from the N.T.R. College of Veterinary Science, Gannavaram, are organizing an international webinar series. For the moment, we have completed the planning for 3 international webinars slated on the 6th, 13th, and 20th of this October 2020. And we are now here for the first international webinar on the 6th of October 2020. We welcome you all once again and hope you will have the 2 speakers enlightening you all. This is for the benefit of the students and alumni of the entire Sri Venkateswara Veterinary University, the faculty, and all those interested in attending these international webinars. As I have already told you, we have taken the Zoom platform and there is also a YouTube live streaming, and those who have not registered can also watch. And you will have access to all the YouTube videos at a later date also, because we have an anatomy YouTube channel, and through that all YouTube videos will be stored on YouTube channel and they are accessible to anyone even after the meeting for any length of time. That is the advantage of this. So for this first international webinar, we have 2 eminent speakers. You must have all seen the brochure. We first have Dr. Sudhakar Patabhi. He is a proud alumnus of the first batch of N.T.R. College of Veterinary Science, Gannavaram, that is 1998 batch. He was a good student and he was a good table tennis player also. And we should thank him initially because it is close to 11:30 p.m. I think for him in Texas now. And he was obliging our request, and he will be speaking on a very good topic, especially very useful for all clinicians, practitioners, clinical faculty in the universities. So he will be speaking on emergencies in small animal practice, presentation of clinical cases. And now let me introduce Dr. Sudhakar Patabhi to you all. I request Dr. Tomar to please spotlight Dr. Sudhakar Patabhi. Dr. Tomar?
sir. Sir, already.
Please spotlight.
Already
Yeah.
spotlighted, sir.
Yeah, okay, okay. So let me first introduce you, Dr. Sudhakar Rao Patabhi.
Yeah, sure.
He has completed his BVSc in 2004 from N.T.R College of Veterinary Science, Gannavaram. And then in 2006, he has done his Master of Veterinary Science in Veterinary Pharmacology and Toxicology. And in 2012, he completed his ECVF-VG, which is the certification equivalent to the DVM Equivalence Board of Foreign Veterinary Graduates. And 2014, he acquired his PhD from Florida State University. And he has very good academic skills in emergency critical care management and abdominal ultrasound imaging. So he started his career by being a veterinary assistant surgeon in the Animal Husbandry Department of Andhra Pradesh, then being a teaching assistant, then being a research assistant. And then in 2014-15, he was the emergency veterinarian at Cottonwood Animal Hospital in Salt Lake City, Utah. And in 2015-16, he was the lead veterinarian at First Coast No More Homeless Pets, Jacksonville, Florida. In 2016 to 18, he was the associate veterinarian at ABQ Pet Care in Nevada. In 2019, he was the veterinarian in Rio Grande Animal Hospital in Albuquerque. In 2019, from that date onwards, currently he is the veterinarian at his animal hospital in Texas. He has a few publications and a few awards and grants. He received the Florida State University College Teaching Fellowship in 2008, and he also had the Florida State University Dissertation Grant in 2012. He is currently a legal permanent resident in the United States. So that is in brief of about our first speaker of today, Dr. Sudhakar Patabhi. And Dr. Sudhakar Patabhi, we welcome you. I think you can maximize your PowerPoint and you can go ahead with your presentation on emergencies in small animal practice, presentation of clinical cases. Welcome.
1 minute, Dr. Kishore. Hello.
Sir, yeah, just Sudhakar Rao, just hold on. Before that, I will hand over to our Associate Dean, Dr. A. Ravi, sir, to speak on this occasion and introduce our university authorities.
Yeah, sure, sir.
Thank you, sir. Over to you.
Good morning to all of you. And as Dr. Kishore has said, this webinar series we have planned to benefit not only the students, the alumni and the faculty of the university. We have given the opportunity for all in the university, the students across the different campuses to participate in this webinar, not confined only to Gannavaram Veterinary College. And I'm happy that the organizing committee headed by Dr. Kishore, Dr. Sudhakar, Dr. Hari Krishna, Dr. Iqbal Haider, Dr. Tomar have put in a lot of efforts to bring in a concerted effort for this effective organization of this international webinar series. And he has given already all the inputs about this seminar. And without wasting much time, I request our Dean of Student Affairs to address the participants on behalf of the university. Now I request Dr. Sarjan Rao Garu to please address the participants.
Yeah, good morning, everyone. Am I audible?
Yes.
Yeah, good morning, everyone. Associate Dean and other faculty members. I congratulate and appreciate the initiatives taken by the staff, mainly the Associate Dean, led by Associate Dean and Dr. Kishore, the organizing secretary, and other co-organizing secretaries, mainly bringing the stream of alumnus into a webinar series wherein they can give a inspiration to the present students as well as the faculty to take up a kind of research and also to go abroad for pursuation of their future career. In this regard, many times Dr. Suresh Pusala is my junior, exactly 2 years junior to me, but he's a standing as a model entrepreneur. He is a founder of one biotech company, and he's a very good knowledgeable person in terms of research, mainly the innovation of some of the new drugs and all. So we really, the students will get inspired because by seeing this Suresh, they can see themselves in an entrepreneur. They can take a path of becoming an entrepreneur, establish some of the biotech companies. We really, it's a good initiative, and also the first alumnus of this. First alumnus of this veterinary college, N.T.R College of Veterinary Science, the first batch of student today, Sudhakar, he's a very good practitioner, it appears, as per his CV shows. And he must have worked hard in many hospitals, undergone various clinical cases in years. That really, that kind of say exposure will again inspire the students of this university to take the path of becoming a clinical practitioner, going abroad in like US, and they take up the practice, clinical practices in their path. So once again, I congratulate all the staff members who are here and the students take this advantage of listening to the great people. And again, in the second webinar series, like we have Harshavardhan, the coming was here, the series of webinar, and also Srinivasulu. They are all the successful models staying in abroad and all. And also we have Sejian, mainly speaking on the ecosystem and environmental systems. So good people you have chosen, and mostly you are bringing the network of the alumnus into one fold. That's a great initiative to take. And out of all this, not only the students and faculty get benefited out of this, and also we get a very good network program with our alumnus. I wish you all the speakers and also the student friends and faculty members a very happy day today, and you get enriched with this the knowledge power today out of these speakers' messages. Thank you very much.
Thank you, sir. Now I request our Dean of Veterinary Science, Dr. Chandrasekhar Rao, to please address the participants.
Dr. Ravi?
Yeah, yes, sir. Yes, sir. I am audible. You are audible.
Dr. Sudhakar Patabhi?
Hello, sir.
Dr.
Good morning.
Postrenal?
Yes, sir.
Sajjan Rao, Dr. Ravi, and my colleagues and other participants. First, let me congratulate Dr. Ravi, Dr. Kishore and his team for organizing this a series of webinars starting today. As I look into the various themes, rightly the organizing team has chosen different appropriate themes, starting from the today's small animal practice, drug discovery, followed by climate change, then even meat products, then licensing and educational opportunities for veterinarians abroad and all these things. I once again congratulate Dr. Ravi and Kishore and his team. I appreciate the interest shown by Dr. Sudhakar Patabhi. I came to know that he is the first alumnus, alumnus of the N.T.R College of Veterinary Science, belonging to first batch. I look forward for his future support and encouragement to the alumni and faculty of the university. I place on record the support extended by Dr. Suresh Koshla for so many years, particularly for postgraduate research while he was in Biocom in Bangalore. I once again thank Dr. Kusala Suresh in this regard. I look forward all the inputs or the support or whatever means from all the alumni as suggested by our Dean of Student Affairs and Dr. Pratap Reddy. You know, he has contributed a lot to our university in form of Pratap Reddy feed and for his analytical laboratory. Likewise, I request all the alumni who are abroad to support this university in various forms. I wish this series of webinars a grand success. Thank you.
Thank you, sir. And before I hand over the mic to Dr. Kishore, I especially welcome the two speakers of today's webinar, and I also express gratitude to them on behalf of the college for accepting our request and sharing their knowledge with us today. And my special gratitude and compliments to Dr. Kishore and his team, because he has really worked hard in choosing the people and collaborating with other members of his team to make this a fruitful webinar on the first webinar today. And I also place on record the appreciation and the help given by not only the two officers present here, but also our Vice Chancellor, Dr. Gannavaram. He was also interested, but due to some engagement, he could not speak to us today. I place on record my thanks to him also. And I hope the webinar will be fruitful in extending the knowledge base of our faculty, the alumni, and the students. And I express my gratitude to one and all once again. And I now request Dr. Kishore to proceed with the webinar. Thank you all.
Thank you, Associate Dean, sir, Dean of Veterinary Science, sir, and Dean of Student Affairs, sir. The question of alumni has come. I'd like to say a small thing before we go ahead with the speaker. So after Dr. Ravi sir has joined, the formation of the Alumnus Association has taken an impetus at Gannavaram College, and I have roped in 435 alumni into contact with me in a Telegram group, and already more than 2 lakh rupees has been brought as subscriptions from these 435 alumni. And because of the COVID, we could not organize the physical gathering of the Alumni Association of this. And once that is over, we will go ahead with the physical thing. And everything is in pipeline. 435 is a huge number. I'm in regular contact with all the alumni. And because of that, we could get Dr. Sudhakar Patabhi, who is active in the alumni Telegram. So I would like to say that this was what we have done on behalf of the Alumni Association initiation at N.T.R. College of Veterinary Science, Kannada. Now, over to you, the first speaker, Dr. Sudhakar Rao Patabhi.
Hello, sir. Can you hear me?
Yes, please go ahead.
Okay. Thank you, everyone. Thank you, Kishore sir and Ravi sir, and also deans and all great people and students, my colleagues and some juniors. Today, I'm presenting emergencies in small animal practice. I present few clinical cases. There are so many emergencies in small animal, but here I present few important ones. All these cases diagnosed and treated by me in the past 3-4 months. So they're all pretty new cases. So I kind of keep track of them. So I can able to present here. So first one is a cystotomy. First I will explain this case. This is the case 1. 11 years old male, 40-pound Labradoodle. A dog presented to the clinic. The major complaint is blood in the urine. So this case
please,
has been.
Please share your PowerPoint. Please share your PowerPoint.
Oh, sorry.
We are seeing you only. We aren't seeing your PowerPoint presentation.
I'm sorry. Yeah. I thought I shared already. So
yeah.
Okay, so
maximize it, please.
Yeah.
Yeah. Yes, fine.
Okay, yeah, I will start from the beginning. So there are so many emergencies in the small animal practice, but there are few important ones. So all these cases are diagnosed and treated by me the past 3-4 months. First, I will start with cystotomy. Cystotomy, it's a bladder surgery, but I will explain some tricky ones, some funny ones, and how I did mistakes, and what common mistakes we do and how we rectify and everything. Okay, so this is the case one. So it's 11 years old, male, 40-pound Labrador, came to the clinic with a major complaint, blood in the urine. So it's been urinating blood, and this case has been treated by the local vet almost for 2 months with antibiotics like enrofloxacin. It's not getting better, so they came here, came to our clinic, and because we have tools, ultrasound and radiographs and everything. So when I got the case, first I did the regular ultrasound to collect some urine to do the cystocentesis. And then I noticed this. If you look at this ultrasound image, there's this hyperechoic zone, several of those, and this is nothing but stones. So I see the stones, and normally if you see the hyperechoic zones in ultrasound, you can see the black shadow like this. So that's a very clear, significant thing for stones. So immediately I talked to the owner, I'm seeing some stones, so we have to take an X-rays, radiographs to confirm the number of stones and how they're present and everything. So owner okayed it, and I took X-ray radiograph, and I really surprised to see this. If you see here, I highlight those parts. So this one is a bladder. You can see a lot of stones. That's not a big deal. Normally in routine cystotomy, we can do those stuff. But here you can see other one, they stack up in the urethra like that. So it's like all stones, they stack up in the urethra. I really surprised the dog is still urinating, but it was very lethargic by the time we see that patient. So here I talked to the owner. This is an emergency surgery. We have to do emergency because if you keep it like this, dog get blocked, cannot urinate anymore, and then lead to the uroabdomen. So owner okayed and says, okay, go ahead, proceed with the surgery. So that here the tricky part is you need to put these things back into the bladder. If you don't, we have to do the erythrostomy. That's another, there's a lot of complications with that. If you do the surgery, and there are a lot of post-surgical complications and recurrent urinary tract infections, and there are so many complications. So my major goal was to put all these stones from urethra back into the bladder, and then do the routine cystotomy to take the stone out. So here I pass the catheter. I use a Frenchy catheter size 10. You need to select the right catheter for the urethra because you don't want backflow. So it should snugly fit into the urethra. And I pass the catheter, but the tricky part is I do normally inject 2 ml of sterile lube, so that can give a minute or two, and then use some saline to use a jet force to push all those stones back into the bladder because of the lube, and they can move in the urethra, and then they can go back. I was lucky. Sometimes it may not possible, and you end up doing the erythrostomy. So here I was lucky, and I was able to put all the stones back into the bladder. And after that, I did a routine cystotomy and open the abdomen, open the bladder, and take out all the stones. I use flushing from inside to outside, from outside to inside. You need to pass the catheter from bladder to the outside, make sure there is no stone stuck in there, because you need to keep this catheter all the time in the urethra. Otherwise, some stones might slip into the urethra, and you thought you removed all the stones and then closed everything, and you need to take a post-surgical X-ray to make sure that you got all the stones out. So this is the one after I took all the stones out. But I highlight this part, you can see that there is one small stone there. It's a very tiny one. I was like, oh my God, I left one, so I have to go back again. But if you pay attention that, this is the os penis. This is the common part where most of the stones, they're stuck here behind this. Once it crosses that one, so there is no point of obstruction. So when dog urinate, it will push through and come out. So that did happen. So luckily there is no stones left. One time it happened to me with a cat. There are some 18 or 20 stones. I thought I removed everything. And then when I took X-ray, I see something behind here. So I need to open up, do the everything surgery. I repeat it, and I need to take it out. So this is very common mistake, and we need to be very careful when you are removing multiple stones like this. So after removing the stones, they look like this. There are so many tiny ones and sand-like things. So you need to make sure you flush really well to make sure you don't leave any stones. So we send these stones for stone analysis, like urolith analysis. This is the University of Minnesota. So University of Minnesota in the US, they do free analysis for the local vets. So we send the sample, there's a lab, and they do free analysis. They charge a minimal price, like $10 or something. So they analyze the stone. So what is the stone major component, and what is the shell, what is the main nidus point, and they will analyze the stone. So there are two major stones, calcium oxalates and steroids. I will explain later slide what is the importance of calcium oxalates and steroid. So that's how I keep this slide just to make sure, just to show that how the universities are tied up with the local vet here, how they communicate each other, and they help a lot. So Texas A&M do the gastric panels, and Minnesota University, they do this, and Washington State University, they do M.D.R, gene 1 defect analysis. So each university took up one kind of field problem, and normal labs cannot do. The university labs can do that. So that's what I just keep this slide to show that. So that's about the first case. And second case, here is a cat, 7 years old male, 12-pound cat. The presenting complaint is straining to urinate, and also sometimes owner is seeing blood in the urine. So the important thing is here, the patient is being on urinary SO diet for 3 years. In US, they sell this prescription diet. Prescription diet means we need to prescribe them to get, it's a prescription diet. It's not, owners cannot get outside without any prescription. So that means there is a medical purpose for that. So urinary SO and C is from the Royal Canin. CD diet from Hills Vet. These are the two brands we normally use for urinary health. So I will explain what is the purpose of these diets. So the cat has been on this diet for 3 years and still having the hematuria, and owner came to the clinic, and she mentioned that, my cat is being on urinary SO diet and still having this problem, and see it. So I took an X-ray. I call X-ray here, that's the colloquial radiograph. So we took a radiograph, and you can see here a lot of stones in the bladder. I count it's around 18 stones, small ones. So I talked to the owner, there is stones, and we have to remove those and do the surgery. And the owner mentioned to me, 3 years back, we got the same issue, and my cat has stones, and they did the major surgery, and why still I'm seeing the stones? So then I went back. I went to the file and get the 2017 picture of the cat. So you can see there is a big bladder with a lot of stones in it. And then by looking at this image, you can see the bladder is so big, the cat is blocked. Blocked cat means it's a urolithiasis or stress or some unknown reason. Male cats get blocked. That means at the end of the urethra, at the penis tip, there is a lot of, sometimes stones, sometimes red blood cells, they clog, and then they obstruct the urination. So that's what it is. And the major surgery owner was talking about is unblocking the cat. So they unblock the cat, and they put the urinary catheter for 2 days, and then they put on IV fluids until the urine is clear. And once that resolved, and they send home. They didn't do the surgery. The veterinarian that time, they didn't do the surgery, and they leave the stones like that, and they put on a diet, urinary SO diet in this patient. So their assumption is it might be steroid crystals, and they can dissolve in the urinary SO diet. If you look at this small picture here, the pH 7 here, and above 7 is alkaline, and below 7 is acidic. So in alkaline pH, we normally in the urine, steroid crystals are formed. In acidic environment, calcium oxalate crystals will form. So steroid crystals can be dissolved, but calcium oxalate crystals cannot be dissolved. But the diet will prevent further formation of crystals, but it cannot dissolve once the stones forms. So I think that's what happened in this case. The owner doesn't know. Owner thought the problem solved, but the crystals are not dissolved. I see the exactly same number of crystals, same number of stones. When I took a X-ray recently, after 3 years, the stones are like that. And now this is a problem. We have to remove the stones, but at any moment they can obstruct and then cause the same problem. So I talked to the owner, and we are scheduled for the surgery. And after that, everything is routine cystotomy. But thing I want to explain here is type of crystals. And some crystals can be dissolved like struvite. Some crystals cannot be dissolved like calcium oxalates. And there is some, we need to understand what we try to dissolve, because sometimes they can, if you try to dissolve and they can cause obstruction. Okay, this slide, I just want to show what is, how the blood work looks in blocked cat. Here, if you look at this one, immediately after blocked and when they did the blood work, the BUN, creatinine, phosphorus, all these three values are elevated very, very high. Those values are very high. So this is called postrenal estremia. So estremia means BUN creatinine ratio goes up, it's called estremia. But look at these values, they are crazy. They went up so much because it's an obstruction. Problem comes when the potassium level goes above 5.3. When the potassium level goes up, leads to the hyperkalemia and cause erythemia, and cat can die with that. So immediately they did unblock it. That's what one knows is a major issue, major surgery. So they did unblock, and they put on fluids, and they put a urinary catheter and collect the urine for 2 days, and the BUN comes back to normal like that. So it is as crazy as like this, it can come back to the normal. So that much variation you can see in the blocked cats. So I will just explain this chemistry a little bit. Here, BUN, creatinine, phosphorus tells the kidney function. ALT, ALP, GGT, total bilirubin tells the liver function. And sodium, potassium, all this electrolyte imbalance, there is a lot of importance of these electrolytes too in the clinical practice. So that's about cystotomy. I will go to foreign bodies in GI tract. This is a very common thing in small animal practice. We see a lot of foreign bodies, and diagnosis is really challenging because not all foreign bodies are radiodense. Some you cannot see in the X-rays, but you can see only the pattern after blockage, how they look, how the intestine looks, how the once they block, how they look, how the intestines get ballooned, and also sometimes linear foreign bodies, how the pattern looks like. I will show one linear foreign body, one complete obstruction, one is not obstruction but still foreign body. I will show different pictures here. First one is a case 3. It's a 2 years female cat. Presenting complaint is won or saw while patient is swallowing the tape. The tape is nothing but Amazon cardboard tapes. Since it's a stay at home and a lot of people staying at home and doing the online shopping, they got a lot of card boxes with tapes on it. So he saw that a cat is swallowing that tape. So I took X-ray and I can see some material in the stomach, but it's not clear. So I did barium, and I took, so there are a lot of series of barium studies, but I'm showing only one here, 1 hour post barium. So you can see barium coated some material here. So it's still, you can see in the stomach, everything is passing in the small intestine. I didn't see any obstruction pattern here. Everything looks fine. The cat is not obstructed yet, but it's going to be obstructed eventually because that much material she swallowed. One is pretty sure. So this is a good case for endoscopy, but we don't have endoscopy, and I asked the owner to go to the specialist for endoscopy, but owner don't want to go, and she mentioned us to do the gastrotomy. So we did gastrotomy, and afterwards, once you diagnose, afterwards it's all straightforward procedure. So we did gastrotomy on this, and we found that it's really 18 inches long tape. I don't know how cat got into and how you can swallow that much big long tape. That's really puzzle, but I really removed that much long 18 inches tape. This image is not from my case. I don't know, I forgot where I got this one, but we never ever do barium in this kind of patient. If you look at this image, there is a gas trapping in the abdomen. That's why you are seeing the serosal details like that. So that means there is a perforation happen. Either it's a gastric ulcer perforate or small intestine perforate. So gas trapped in. So you are seeing the clear details, and you don't want to put on barium. So barium can leak through it, and it can cause peritonitis. So that's why we never. I put this slide just to show where we don't do the barium. So next one is the same tape. So how crazy it can become. So we removed one cat with the tape, and we got immediately after a week or two, we got this case. We really surprised how cats are getting into these tapes. So that time we don't know what happened. The case came just a profuse vomiting for 2 days and very lethargic, severely dehydrated, 13 years male cat. So lost a lot of weight. Owner waited for long and came to us, and I took an X-ray. When I look at this X-ray, you see the bunching of intestines here. So immediately, VD presentation is very important in this case. So we did VD, and we can see plications here. So I highlight this, and I also draw how plications look. You can see here how the nice plications here. So when we see these plications, that is super emergency. So when the plications happen, so you can see some linear foreign body here in the stomach. So it is not a complete obstruction, but it messes up the peristalsis movement. So that's what plications happen. All the intestines are bunching up. And when this happened, I diagnosed it, and I recommended surgery, and I have to leave the hospital. And my schedule is done, and next surgeon came, and he tried to do it, and unfortunately the cat died. It's like a surgery is success, but patient died kind of episode. It didn't wake up from anesthesia because this is 13 years old, lot of time owner wasted, and plications happened when they open. I see the images afterwards. There is full perforations everywhere. It's not complete perforations, but all very weak membranes all over the intestine, and also severe peritonitis happened, and septic shock. So patient couldn't make it. That's why I just showed these two, how these tapes are causing issues in the cat. And if you recognize early and find out, diagnose early, you can save lives. So next one is it's a dog, 2-year female, 84-pound cane corso dog. The presenting complaint is same: vomiting for a day, not eating, and there is no defecation. So if it is a complete obstruction, there is no defecation. And you can see in the X-ray the ballooning of the intestine. We need to make sure it's a small intestine, because if it is a large intestine, there is no obstruction. Most of the times, foreign body obstructions happen in stomach and small intestine, but not in the large intestine, because large intestine are big. Once they escape the small intestine, they can easily pass through and they can come out of the rectum. So here, lateral view is not a clear indication. This is we don't know it's a colon or it's a small intestine, but there is a ballooning here. So normally I see the L5 lumbar, fifth vertebra body width. If it is 2.5 times to this width, then it's a highly suspicious for foreign body. So we took VD views, ventrodorsal view. So you can see the small intestine loop is way bigger. So that is a clear-cut case for the foreign body. And also you can see some kind of material not clear. It doesn't look like any ingesta or anything. It looks like something abnormal material. So I strongly felt this is a foreign body, and then immediately I went to the surgery and we found that. So here is a healthy part. This is the obstruction. You can see how angry the intestines are, very inflamed. Entire mesentery is also getting inflamed. So we have to make an incision in the healthy part and go a little bit into the affected one, and slowly you need to wiggle it out to take it out. Never make an incision on the affected one because it's already inflamed. They don't heal well. There is always a complications comes from that. So we open here and then slowly wiggled out and took this one out. This is nothing but a basketball, kids basketball. So dog chewed it and swallowed it. It's really almost here about to perforate, but luckily it's not. So I don't need to do anastomosis. It's a simple enterotomy, open up and take it out and close it. So it's nothing really crazy surgery. Dog did well, everything fine, but it could be very serious once it perforates. So not all cases, all foreign bodies are for laparotomies. Some are we can wait. So here in this I just zoomed it a little bit. You can see that fabric material here, some material in the intestine. So same thing, 8-month-old, 70-pound male lab dog, labs. So if they are puppy, if it's a Labrador, they are high likely getting into stuff. So they're presented for inaptitude for a day, and owner suspect the patient might get into something. So we took an X-ray and we did see a lot of cloth material here. So, but I didn't convince there is an obstruction here. So because I didn't see any bigger loops, and I took the VD view also, small intestine looks smaller. It's nothing really obstruction. So, but still patient is showing some inappetence and also nausea. So I put on fluids, give a hydration, and after 6 hours of hydration, and I walk the dog outside, and it defecate large amount of feces there, and it defecate, and also at the end it start to strain a little bit. So that moment I think there is something is passed. So before that I also give some barium, little bit barium, not too much, and see how the barium can pass if there is no obstruction. So I brought the dog inside and I did the parrectal exam, and I can palpate the socks in the rectum. So I just gently pull it out. So this is the socks here. It's about to go into the colon. So it passed easily, and we took it out and we avoid laparotomy. And next day I asked the owner to come back and take one more view to see this barium is completely passing or not. So it completely came back and everything looks fine. So that's why, in our practice, foreign bodies are the real issues. It's always a cut to or not cut to issue. We have to do the surgery or not, because surgery, laparotomy cost around $2,000 in our clinic. In emergencies, it cost around $5,000. So it's very costly episode. And also prognosis is all depending on how quickly we diagnose. Sometimes if you delay, even though, you charge the owner, but they couldn't make it because it's already too late. So this is a very challenging thing always, but it's always fun to when you take out all the foreign bodies. It's always owners, everybody loves it. So that's about foreign body. Next one is a splenectomy. Why we do the splenectomy? Because there's few incidents we need to do the splenectomies. Spleen normally has two kind of tumors. One is a hemangioma, other one is hemangiosarcoma. These are the tumors. When they start to bleed inside, we have to take it out. Sometimes if it is a GDV, spleen get torsion along with the stomach and also get necrose, and we have to remove the spleen. So I will present here a few emergencies and one non-emergency I faced just the last 2 months. I will present those two cases. Here, 9-year female lab mix, and it's a 55-pound. Presenting complaint is a lethargy, distended stomach, not eating, not playing with the other dogs, and one was very concerned and brought here. So on my physical exam, I kind of palpate outside, there is a distension there. So immediately I did ultrasound, and you can see there's a big tumor. I couldn't find even the border where it originated, but I can kind of sense it. It might be from the spleen, but I'm not sure. And I see some little fluid building up. It's a bleeding inside. It's a hemoabdomen is forming. So the ultrasound type is called A-FAST ultrasound. We normally do to find out any fluids in the abdomen. Here, the interesting thing, if you look at the blood work, it's an interesting factor here. Hematocrit is 23%. Normal values are 37 to 55%. RBC is 3.3. Normal is 5.5 to 8.5. So there is a clear evidence there is a bleeding happening inside the abdomen. That's what you are seeing, that low hematocrit and low RBC. So another important and interesting thing, in the blood work, in the CBC, I always like it, RDW percent. That means red blood cells distribution width. So normally normal percent is 12 to 17.5%. And if you see 20.5%, I will explain what is RDW percent means. Distribution width is a complicated term. It's in simple words, it is average red blood cell diameter. So when average red blood cell diameter is more, that means the bloodstream has more immature blood cells. If average RBC diameter is less, that means normal regular RBC, because when they are immature, they have nucleus, the diameter is big. That means body is trying to compensate. When body is bleeding, when there is less blood, the kidney sense the hypoxia and produce erythropoietin and ask the bone marrow to compensate and produce more red blood cells. And bone marrow is in a hurry to compensate and squeeze more immature blood cells into the stream. That's what we get more immature blood cells, and that's why we see the more increased diameter. So that's what we're seeing, 20.6. That means it's a good thing. The body is, kidney is working, bone marrow is working, body trying to compensate, and good candidate for the surgery. And we can, normally I don't do the blood transfusion when it is 20. I do the blood transfusion when the when the hematocrit is below 15. That is a crisis. We have to do the blood transfusion. Otherwise, patient cannot make it. So 23.2 is kind of okay. We can proceed once you stop the bleeding, and patient can make it, and body can, PCV will go up later. So we did this surgery, and this is a 10-pound tumor in the spleen, the other side of the tumor. So this one, surgery is not a really big thing. It's only that you need a patient, you need to ligate each and every arteries supplying to the spleen, and it takes time. You need to ligate each one, and then you can slowly take it out. We don't have electric cautery. Normally, if you have electric cautery, it's 5 minutes. You can just cut it and ligate at a time, and then you can take out the spleen. If you don't, you have to manually ligate each and every arteries, and it takes time. And make sure it's very febrile, and you don't want to, when I'm trying to take it out, my fingers goes into this, tumor. So it can bleed out more before you take it out entirely. So you need to make sure you gently take out everything without much bleeding. So dog did really well afterwards, and it came out as a hemangioma. So that means this is not a malignant. So dog, it's been like 4 months already, 3 months. Dog is being happy, healthy. There is no issues. So I'm expecting it can have a full life. So if it is a hemangiosarcoma, now I had one hemangiosarcoma before. We don't see the bigger one like this. We normally see the normal spleen, but there is a lot of multinodules and very febrile. And when you touch the spleen, it can break. So when you see that kind of thing, it's mostly hemangiosarcoma. Even you remove it, within a month, dog will collapse because it's already spreading to the vital organs. It can spread to once it goes to the aorta or liver or kidneys, and it can eventually death will happen. So hemangiosarcoma is, we cannot tell until we go in. That's the problem with this. You cannot do the biopsy on the spleen. You have to take it out and send to the lab, and then you will wait for the result. Okay. So next one is another case. It's also the dog present to the regular routine exam. It's a non-spayed pit bull, and they thought it's a pregnant, so they want to check it before they schedule for spay. So I was doing the routine ultrasound to find out the uterus, but I didn't find the bigger uterus or anything. It's not a pregnant, but I found this little tumor there. So that's not a good thing, because if you have a big hematoma like this, what happens is in a year or two, it can grow bigger and bigger. And at one point it ruptures and it becomes an emergency surgery. So instead of that, I talked to the owner that it's a good idea to do the elective surgery, take out the spleen when we are doing the spay. That way it takes less time, and it doesn't have much adhesions to the tumor, and also she had, there is no bleeding, so that's a good chance that we can avoid the inevitable thing in future. So one advocate, and we removed it, and it ends up finally we found it is a splenic hematoma. Hematoma is nothing but a blood sac. It will grow and bigger, and it will rupture and it become an emergency too. So that's about splenectomies. Splenectomies are emergency depending on, suppose if it ruptured already, so it's an emergency, but only crucial thing is PCV. Hematocrit is very important. If it is too low, blood transfusion. If it is okay, about 20, we can go ahead and do the surgery. But outcome, we don't know until we send to the lab and get the biopsy. Get the histopathology results. So that is about splenectomy. And the final one is Addisonian crisis. So this one, I did a lot of mistakes, but luckily I'm able to correct it at the end. So this case, I just sent home like today. We got the results and everything. Dog is happy, and we sent home today. And I put the last test tube there. So here it is, how it comes. It's rescued from the shelter, and it's a 2-year-old dog, terrier mix. It's not spayed, and they want to check up with me just to schedule spay. So, okay, I did the exam and found heartworm disease. It has normal shelter dogs. They do have heartworm disease in Texas here. So I put on a doxycycline before we start the heartworm disease treatment, and we sent home, and everything went well. After 2 days, he came. He's not eating at all. So I thought it's maybe because of doxycycline. Sometimes it causes inappetence. So I thought, okay, it's a doxycycline. Just give some subcu fluids and some saline injection. Sent home, should be fine. And he came back yesterday, severely lethargic, not doing well. It's very kind of nauseated too and not moving. So I did the blood work and I found BUN creatinine, and this BUN creatinine is super elevated. And I thought, oh, is something acute poisoning happened? Like, why the dog is happy yesterday and suddenly became like this. So something is a toxicity. Let's put on fluids for 2 days and everything would be fine. So everything indeed fine. BUN almost normal. I did ignore this part. I thought maybe dog not eating, that's why glucose is a little low. So I sent home with a normal serenia, and the dog started to eat after fluid. And he went back home, and pastor next day came after next 2 days. He came back. It's declining. It's not eating since I got home. And again, I did the blood work, and I got similar like this again. Oh my goodness, it's something, it's a irreversible acute kidney toxicity maybe, and maybe leptospirosis. Let's do the leptospirosis. And we did the leptospirosis first time before I put on antibiotics. So that came negative. So we put on fluids again and come back to the normal. Dog start to eat, sent home. Again came back. This all happened in a span of 7 days. So the problem happened in the beginning in the history. I didn't collect the proper history, and pastor is unable to provide me history because he just rescued from the shelter. We don't know how long dog is being sick. It's like on and off. All metabolic diseases are chronic ones, so they don't happen overnight. So, and then I shut down everything. And moreover, here is the dog. The skin condition is also getting worse, like skin scaly, getting scabs, and we did the skin scraping, rule out the demodex, and rule out the atopic dermatitis. Nothing is working. We thought is something wrong. Just let's focus back and do the complete. Then I thought maybe the kidneys is not working. Let's see how it is. Kidney is the one which controls our electrolytes. So I thought let's do the electrolytes, and it came back like this. Sodium is almost low, hyponatremia, and potassium is too high, hyperkalemia. So the sodium potassium ratio is 17. When sodium potassium ratio is below 25, that is a very striking rule out for Addison's. There are some other factors, other conditions cause sodium potassium ratio low, but we need to match up with the clinical signs. So I thought, oh, maybe it's Addisonian. That's why we are not, she's not responding well. So I gave a steroid, dexamethasone, DexISP IV, and dog became a different one. So I added dextrose. So we all know that if we add dextrose, this will take potassium out of the bloodstream into the cell. So that's why we get hyperkalemia to normal potassium levels. That's why we don't see any erythemia issues. So after this, overnight, dog eats really well. It's a different dog and all like new dog. So, and we confirmed, no, we tentatively diagnosed it's Addisonian, and we did the ACTH stimulation test. Here, time frame is different. It's a tech put wrong. It's a 1 hour. So first we collect the sample and we inject synthetic, it's a cosintropin, it's a synthetic ACTH. Basically, ACTH is it's a hormone from the pituitary gland, which stimulate the adrenal gland to produce aldosterone. And one of the corticosteroids, mineralocorticosteroids, and 6 corticoids. So corticocorticin, we give this dose 5 micrograms per kg, and wait for an hour and take this another blood sample serum, send to the lab, find out how the cortisol levels. Because if you trigger with a high amount of ACTH, the normal animal should produce more steroids, but this dog didn't produce anything. So that is way low. So here we are giving a DOCP. This is a synthetic corticosteroids. That's a desoxycorticosterone pivalate, I guess the full name. It's a zicortland percotin. So there is a protocol how to deal with Addison disease. Once we diagnose, the problem solves. That's the major issue here. And that's once you diagnose the treatment, everything is routine. But here, what I missed is I felt like I didn't take proper history. Since it's a rescue dog, that's first of all, I was a little lenient. And also foster doesn't have much information. That's another thing. So in our clinical practice, this is very important thing, taking a proper history. Otherwise, we completely mislead. And I was at the stage to call for euthanasia at one moment. Like, maybe dog has a acute kidney failure and it's irreversible. Maybe it's a hopeless. And at the last moment, I somehow it clicked and worked out. So this is all my clinical cases. I don't know how much time it is. I still have time or. Yeah, so that's my clinic, all the staff, and this is my work lab, and these are workstations. This is the animal hospital. So, yeah, that's all. Thank you very much for everybody. And if you have time, I can show some extra images.
Yes, Dr. Sudhakar Rao, you have time. Please go ahead.
Oh, okay. So these are just a fun images. These are not recent ones. So in my entire career, I saved some images and I just putting here a little bit. So this is the ultrasound image of stump pyometra. So this is a very rare thing, happens normally after removing the uterus in the spay. Sometimes the stump of uterus, we leave it. If you don't properly close it, or sometimes you get infection, they become like another pyometra, like a little stub with a pus. So this is how it looks in ultrasound. Ultrasound is very, very easy tool to diagnose pyometra. It's very easier than radiographs. And this is the bladder, and behind that you see another bladder. So that time I was naive, I was new, and I didn't know, wow, there is something is behind it. Let's find out what it is. And then I put the needle and aspirate, and I got the pus out of it. So basically, then I know, oh, stump pyometra looks like this. I mean, afterwards, we immediately go to surgery and resolve the issue, but this is a very funny one. And this is the spleen, and this is how hemoabdomen looks. When you do the A-fast, under the spleen, you can see the fluid building up. When the fluid build up, it looks like this, black hypoechoic zones. So these are the funny stones I removed a while ago, like almost 3 years back. You can see like almost a paperweight. This is a sidju. The entire bladder is filled with stone here. And when I was cutting the bladder, I'm feeling like I'm cutting on the rock underneath. So that's kind of crazy bladder stone, that one. So this one is also stone too. We would really surprise how a 10-pound dog can have that much big stone. This is I never see this thing in my life, but this is, I don't know how it happened. The cat came for vaccines. I look at that and I just palpate routine abdominal palpation. I felt something weird and I asked to take an x-ray and I did see like this. It's not a Photoshop or anything. It's really happened. I don't know, it's an ectopic uterus or mummified fetus. It's stuck outside and it's a spayed cat. There is no uterus and it's outside in the abdomen and it's all it's all capsulated. And it's surgery wise, it's the easy one, just to go inside and take it out. But I don't know how the cat survived those many years after spay and before spay. Why? Because when you do the cat spay, we make a small hole, so we don't really see much. So that's why I thought it's a really funny one. So this is how is a bladder, and this is the transitional cell carcinoma. So this is how normally cancers, they stay at the bottom like this. Actually, it's not the bottom, it's the dorsal side of the bladder. Polyps normally hang on here, like on the ventral side, polyps. Sometimes you see the clots, they just float. They all look like same, like, you see the soft tissue kind of opacity, like same echogenicity, technically, but that's how it is, like it's a tissue inside. Normally, when you see this, you never do the needle poke or anything because transitional cell carcinomas are malignant and it can transfer it. You are spreading to the entire body. So you basically need to do the catheterization and get the urine or free catch. So this is my final image. This is really crazy how dogs can swallow needles. I don't know why the dog swallowed the needle, but it did. It stuck in the larynx like this. So it's an easy one, not as crazy as it looks. When you see any sharp objects stuck in the throat like this, we don't need to open from outside. You open up, and just like how we intubate, and you can use the long forceps and you can just pluck it out. But it's a really scary one when you see it. But it's a small one, just like a needle. It really doesn't hurt anything. You take it out, and that's it. No aftercare or anything like that. Okay, I think that's all. Thank you very much for everyone. I don't know whether it's interesting to you or, but I hope it helps some of you, and uh, that's all.
Thank you, Dr. Sudhakar. It was really very interesting. And I hope most of the clinicians, vet practitioners, academicians in our veterinary clinical complex, they would have benefited a lot from your presentation. The radiographs and ultrasound images were really very good. And you have given a very good narration of all the cases that you have actually encountered. And now I request my co-organizing secretary, Dr. Iqbal Haidar, to please conduct the question and answer session. Over to Iqbal Haidar.
Thank you very much, sir. It was very excellent presentation. There are a few questions for you, sir.
Yeah, sure.
First thing is that sir wanted to know what are the legal complications associated in brief about the clinical practice in your place, like in the United States. What are the legal complications associated and how you deal with it?
Yeah, that's very, it's really tricky here. In US, everything is we documented. We need to be very careful. People can go to the board. Sometimes they can sue you. One time it happened to me when I joined the emergency. Some other doctor, there are 5 doctors involved in the pancreatitis case. And, pancreatitis can be grave, and dog died in emergency. So that guy sued everybody for $100,000 for each one, like that. So people can go crazy like that much. But it didn't stand in the. He sued entire hospital. Like, we are like a 13 team. Whatever doctors involved, not involved, he kind of makes story like that. So basically, when we are dealing the case, we need to communicate properly. We need to tell what is the outcome. We always say like this. People say, I don't know whether I can say this. See this one here. Quote high, promise less. So you can tell, even though you know that you can solve this problem, but you can tell that, maybe this is very serious surgery, anything can happen, because sometimes we don't know what, suppose you say, oh, everything is fine, the surgery is fine, I did 100 surgeries like this, I can do it, no problem. And you go in and you see something crazy and something happened, they can sue you, like, doctor didn't tell me this thing happened. So there is a legal complications always, but we need to communicate properly. We need to document everything and make sure you covered all your bases and make sure that nothing come back to you. But we have an insurance. AVMA, American Veterinary Medical Association, has insurance, so they have a very good lawyers. So if somebody sue hospital or anything, they will take care of it. We are well protected. I didn't feel like any insecure, but we need to be careful, because nothing will happen to you, but it comes to your reputation. Nowadays people can go to the social media, and they can talk on Twitter and post on Facebook, and they talk anything about you, and they can damage your reputation. So need to be careful, but nothing to worry that much too. We can do whatever. Did I answer your question? It seems like very elaboration.
Yeah. Thank you. No, it's very good, sir. So one of the questions from our faculty. So what he's asking is that when you have done splenectomy, did you notice a clotted blood or a blood in liquid nature when you have done splenectomy? So what is the consistency of blood when you have done splenectomy?
That's a good question. Actually, it won't clot in the abdomen. So normally when I see the hemoabdomen, I normally do the abdominocentesis with ultrasound. And because the clotting factors are used up, and normally I keep it outside in the syringe, and they won't clot. So that way I know this is not something, it's not I feel like it's a tumor or something bleeding. So that's why, but normally they don't clot. If it is a hemoabdomen from the splenic tumors. Maybe if it
Okay.
is a
So I
hemorrhages or
think
anything.
regarding the blood, yes, sir. So
Yeah,
there's one more
normally
question from.
Yeah,
Okay.
complete, Dr. Sudhakar. Please
So
complete.
yeah, suppose if it
yeah,
is any
please.
accidents, trauma, you can see the clotted blood. Suppose if you, sometimes you do the fine needle aspiration, you hit the artery or anything, if it bleeds, it can clot. But if it is a continuous tumor bleeding, they don't clot.
Yeah.
Yeah.
Okay. Yes, sir. So there's one more question. I think you have talked about blood transfusion in dogs, and if you see the blood groups, like I think it is based on this dog erythrocyte antigen D grouping. So how do you see the compatibility? Like, is there something like universal donor or recipient, or how care
Yeah.
you take about blood transfusion?
Yeah, I mean, honestly, I forgot the blood types and all those things. When you do the blood transfusion, I do like this. Suppose it's a first time blood transfusion. I don't care what kind of group it is. I just take the donor. Suppose some technician had a big dog, and we collect the blood from it, and then we transfuse. But if it is a second time blood transfusion, and we have to cross match, we take the
Yeah.
serum. Cross match means serum exchange, like a whole blood, and then serum from this guy, and whole blood from donor. So we cross match for the second time blood transfusion. But the
Yeah.
first time blood transfusion, we don't
Yeah.
normally select anything. But we do the cross match. There is a
Okay.
kit for it, so we don't remember what type of blood type or anything. They are selling the kits.
Okay.
We just add those stuff and
Yeah.
find out if they match or not. So I kind of forgot this what group it is, the cat groups and
Okay.
dog groups. But I just
Okay.
remember what I need to do.
Okay.
Yeah.
Okay. Okay. So the last question, sir, due to lack of time. So you have talked about prescription diets. So how many kinds of prescription diets are available in market? Actually, how many kinds of prescription diets are available? Or is it very broad range, or you have only few which you suit to your case?
Yeah, it's very commercialized here. There are so many varieties of prescription diets. Um, the two major brands are Hillsweat and Royal Canin. There's two companies are producing these prescription diets. There are GI diet for gastroenteritis problems, urinary problems. Just now I talked about urinary diet and CD diet, and kidney diets. Normally, kidney diets are low in animal protein. There is a scientific uh, principle behind it. For example, cat with a chronic kidney disease. So when they have a chronic kidney disease, because cats are absolute carnivores, they eat a lot of animal meat, they damage their kidneys over the period. So they need to have less animal protein. So they came up with a one formulation, and that has a less animal protein,
Okay.
and also less phosphorus, and then protect the kidneys. There are so
Yeah.
many kidney problems. Weight reduction diets,
Yeah.
WD diets are we commonly use for fiber
Yeah.
supplementation, weight reduction, and also for the diabetes.
Yeah.
There's so many. You name it, every problem has one diet.
Yeah.
Yeah.
Okay.
So there are so many diversity. If you go to the online and Google Hill Sweat,
Yeah.
hills, like 7 hills, like Hill
Yeah.
Sweat, and Royal Canin. So these are the two
Okay.
brands. And recently, Blue Buffalo is also coming up with different diets, but I don't really like it. They're over commercialized. But I like Hill Sweat
Yeah.
and Royal Canin. But everything, there's so many, ID diet, KD diet, HD diet. I mean, there's
Yeah.
so many all problems, heart problems. There is something, or joint issues, something. Even there is a one good thing here. Hypoallergic diets. They call hypoallergic diet. The simple phenomenon is
Okay.
they denature the protein. They
Yeah.
superheat the food, and they denature the protein. When you denature the protein, you don't have any antigens. So there is no allergies from it. So they're selling like a hypoallergic diet. Basically, they are overcooking to make it
Okay.
less allergic. So
Okay.
there are some very good one. I like few. I felt like some are just a commercial purpose.
Yeah.
Some owners do Googling, and they ask Dr. Google what is the best diet for my dog, and they came to me and asking, I want to get this diet, and we just comply with it. Just go ahead and give the same diet. It's nothing. It doesn't hurt.
Yeah. Okay. So I think just one last question from our organizing secretary, because we have talked about Dr. Google. So how do you actually handle the patient, I mean the owners, in terms of counseling when you are doing the treatment?
When they're coming up with the
Yeah,
ideas.
yeah. When they come, yeah, when they come up with
Yeah.
ideas and when they come with their pets, what is the role of the counseling in how you handle the
Yeah,
cases?
we need to be well. We need to deal with them really well. Like, we need to show them that we are better than Dr. Google and we know better than them, and don't trust them. Once they know you personally, they will trust you. And
Okay.
if you say, oh, no, no, that's wrong, then they will trust you. But if they don't trust you, they say they're just okay, but they will still trust the Google and their Facebook friend who
Yeah.
suggested something else. It's
Okay.
normally happens, but normally, we can explain better. Like, this is the truth. There's a lot of misinformation outside,
Yeah.
and don't trust that. And then, once they trust you, they will believe you. But it's a really challenging one. I don't have a perfect answer for that, but
Yeah.
it's a really challenging one, and we need to direct them the proper correct information. You know.
Yeah. So Dr. Google is the biggest competitor for you there.
Yeah,
Okay.
yeah, it's a kind of, everybody is, in India also nowadays, I think most
Yeah.
of clients coming up with already diagnosis. My dog has this, just to treat like this. So
Yeah.
we have a stars on the client name. So someone is crazy like that, we in our system we have a stars name. So if they come a second time,
Yeah.
and we already well prepared for them, and we are ready for them. So
Yeah.
we track their information, and whenever they're coming up, they see the
Okay.
schedule, and we'll well prepared for them.
Okay. Okay. Thank you very much, sir. We have some more questions that we will be posting you for the answers due to lack of time. So thank you very much for an excellent presentation. And I would now like to ask organizing secretary to please take over the proceedings.
Yeah, thank you very much, sir. Thank you everyone.
Thank you, Dr. Sudhakar.
Sir, your voice is not audible, Kishore, sir.
Yeah. Thank you, Dr. Sudhakar Rao. It was a really nice question and answer session too, along with your good presentation of the images. I think many clinicians will benefit a lot on the variety of cases that you have shown, and for which you need to take radiographs, and how ultrasound is very helpful, especially after you have done some hysterectomy cases and all. You have shown very good things. And the stone analysis that you do over there, normally we generally don't do the stone analysis. We just remove the stones and all, and complete the surgical aspect. But it is a very important aspect why we need to do stone analysis. So these are all very good highlighting aspects. And apart from this scientific aspect, anything just for 5 minutes plus, would you like to tell anything about your progression from N.T.R. College of Veterinary Science, Gannavaram in 1998 to you being a speaker today? Maybe this is on your personal front, for the benefit of all alumni. As I have told you, you are in the group. We have 435 alumni. So on your personal front, your journey, just highlight for 5 minutes plus.
Yeah, I mean, when I know that, I didn't join veterinary science, I joined veterinary science reluctantly, basically. And I think, Dr. Kishore, you are the first one I met you in a bus. Or maybe you don't know me that time, but I hear your voice in the background. You're talking about your new college coming, we are all starting up and all the stuff. And I was listening to you, but I didn't talk to you, but I know you're talking. So basically, I joined reluctantly, but but I was lucky that time. Dr. Kishore and Prasad sir and our dean Subara sir, and there are so many, like Yuganda sir. They're all like in the pioneers of we call the university. They motivate, and actually I was so lucky that. And afterwards I never took back, and I didn't. I thought even go back to the even for MCET exam to go to the medicine. But once I go to the anatomy, and I really thrill with the bones and muscles, and So the interest took up on, and really I enjoyed. We learned a lot, and also it's a first batch. We are just 18, and everybody focused on us, and they all treated uh, like a kids. Like we really we we are really lucky that time. Normally, you don't get that much attention and guidance that time. But only the drawback is we don't have seniors, but their professors are our seniors, and we took a lot of hardships because we don't know what to do next. Sometimes we don't get proper information because there is no seniors. At that time, people told that it's getting licensed in years is really tough and a very cumbersome process, but it's not. It's not that it's not as tough as we pass BVS in India. That's for sure. It's you should know the proper path, and then you can get the license. A lot of people from our university. There are so many people. There are professors here. They are doing the research. I also did my PhD. First, initially, my thought was I learned veterinary science very well. Then I do some research, and I'm interested in pharmacology initially, and then I came to ES. I did the research in mesenchymal stem cells, and I thought maybe I can use stem cells in dogs one day. That was an idea. Maybe in future I might use regenerative medicine, but at this point not. But it's a lot of journey, and but we are lucky to have proper guidance. That's the most important thing. That's what I think this alumni is used for. There's a lot of diversity in the alumni. There are public servant people, innovators, and research people, clinicians. So I hope it would be a guidance for the future generation. Uh, that's all, sir. That's basically.
Yeah.
Before Dr. Sudhakar.
Yes, sir.
Hello.
Yeah, yes, sir. Can you hear me?
Yes. You said about the diversity in the alumni. How best we can use that for the college? What's your opinion? Because we have formed an alumni association in Gannavaram College. How best we can open this alumni and use their knowledge base, or
it's
even
getting,
to some extent their wealth.
yes, sir. It's basically it's knowing things like people know my face right now. Maybe they can contact me, and if they want any advice. If suppose some people are interested in coming to ES, they can contact us. Basically, knowing having the same platform is really helpful, and they can ask questions like how to come here and what to do and what exams I need to take, how hard it is. So getting together is more important, like webinars like this, bringing onto the platform. And basically it's not just presenting what we're doing, but it also telling we are here, like that. So uh, we have like Dr. Sanyas Rao is also in the public service. Satyam, Rahul, they are assistant professor in ES. There's so many people. So if future generations knows that there are people in different areas and they can contact easily. So common platform is really important. This is one of the things. So we can use them, bringing here, let them present their work, and maybe invite to the university. If somebody doing a great research in ES, coming invite to the university, and they can interact with all the young, new generation. And also collaboration is a very important thing. That's what I see here in universities. Collaborations are really, really important between different departments. For example, if they have suppose Rahul is doing some virology, Dr. Rahul, my 98 batch, but he passed out as a 99 batch. He's doing he's a professor in Ohio. He's doing some virology research. So there must be one virology department in our university. So they should have some tie-up work. They can share the common project. That way, some students can come from India to the ES to get some experience and go back. So once we have collaboration, it's the knowledge sharing is the key. So that's my opinion, sir.
Okay, thank you.
Okay, Dr. Sudhakar Rao, because you mentioned the stem cells earlier, I said you had good publications. So for the benefit of viewers, I would like to say that he had a publication, Human Mesenchymal Stem Cell Osteoblast Differentiation ECM deposition and biomineralization on PAH-PAA polyelectrolyte multilayers, published in Journal of Biomedical Matter Research. And another good publication of his is decellularized ECM effects on human mesenchymal stem cell stemness and differentiation. So these are the good publications that he had, and his work on stem cells is a result. And these are the publications that show that he has worked on stem cells. So thank you very much, Dr. Sudhakar. And
Thanks.
we hope that through the alumni group that we have about 435 alumni, and many of them would have watched this, and this message will go through. And we hope to have a strong alumni network in N.T.R. College of Veterinary Science, Gannavaram. So thank you.
Thank you, sir.
Please don't leave. Please hold on if possible. I know it is past midnight, 1 o'clock to you in Texas, but hold on for at least 10 minutes so that you can minimum hear to the second speaker.
No, I'm hearing the next session too, sir. I'm hearing Dr. Suresh Posala. I'm really excited to see what
very good, very
yeah,
good,
very
good.
I'm not sleeping yet.
very good, because it's past midnight, 1 o'clock to you.
No, that's fine. Sometimes my daughter wakes me up all the midnight sometimes.
Yeah,
so
fine.
Thank
you. Now, it was a nice, good first presentation. Now we'll switch over to the second presentation. I think the speaker would have been waiting for some time. So before I go into the second presentation, I would like to say that this international webinar series goes on, and the second and the third international webinars are slated for the 13th and the 20th of October. And for the 13th of October, we have Dr. Hari Attagarla. He is also the classmate of Sudhakar Patabhi, the first 98 batch alumnus, who will be speaking on veterinary licensing, AVMA, for foreign veterinary graduates in USA. And that will be followed by Dr. Sejian Veeraswamy, a postdoc from Australia, who will speak on climate change and livestock production, overview on current and future perspectives. And that will be followed by Dr. Nidhi Rajput, with a rich experience from Virginia, USA. And she will be speaking on vets versus wildlife conservation and insight. And this is for 13th of October. And on 20th of October, we have our third international webinar, where we will be having Dr. Srinivasulu Kilari from Singapore. And he will be speaking on personal experiences in a professional journey and interactive session, being the director of MSD Animal Health Innovation in Singapore. And that will be followed by another alumnus of our university, Dr. Harshavardhan Tippareddy from University of Georgia, Athens. And he is a professor of poultry science, and he will be delivering the talk on microbiological quality and safety of poultry meat. And the last one on 20th will be another alumnus from our university, Dr. Kavita Kongara from New Zealand. And she will be speaking on study and academic opportunities for veterinary graduates in New Zealand. And she is an MVSC surgery, and she is working as a professor in Massey University in New Zealand. So that is our schedule. And now we will move on to our second presentation. And before we ask our distinguished speaker to speak, and maybe if I need to introduce his brief biodata, I am going to give a mini presentation sandwiched between the two major presentations. All of you, please hold your breath to hear to the brief bio of Dr. Suresh Posala, TVM MS, PhD. Suresh Posala is currently the founder of a biotech company called OncoSeq Bio, which is incubated at the University of Hyderabad BioNest and at the AAC CCM. He is also a partner and investor in Reagent Biosciences. Suresh is actively pursuing research that has the potential to disrupt drug discovery and has several applications in assessing safety, discovering new chemical entities, and understanding of many diseases. His companies are actively involved in developing platforms for drug discovery and screening for various indications such as cancers, Alzheimer's, NASH, and COVID. Suresh was Chief of Comparative Medicine at the National Institutes of Aging, NIH USA, from 2001 to 2008. Until recently, he was Senior Director and SLT member at Bristol Myers Squibb and established the preclinical facilities for Syngene BBRC in Bangalore and at BMS Redwood City, California, USA. He has excelled at NIH and BMS, winning the NIH Directors Award and BMS Galaxy Award for Leadership in Science. Prior to NIH, Suresh worked at St. Jude's Children's Cancer Research Hospital, Memphis, and he was a resident at University of Maryland and taught in a medical school. Suresh graduated with a veterinary science degree from AP Agricultural University, Tirupati in 1986 and earned a master's in microbiology and immunology from the same university. He received his PhD from Iowa State University in USA in 1994. Suresh is involved with DBT, FSSAI, ALAS, LASA, FABA, SAEA, etc. He is a member on several other organizations that promote research in medicine and biotechnology. He has published 30 scientific papers in reputed journals, including Nature, PNAS, Immunology, PLOS, etc. He has brought the awareness of quality in vivo research to India. Suresh is actively involved in promoting biotechnology, alternatives to animals in the scope of 3Rs and research in diagnostics and therapeutics. He was an active team member in two stellar humanized antibodies, Yervoy and Opdivo, developed by BMS for skin, lung, kidney, hematologic, and many other cancers. He is also actively involved in finding solutions for many geriatric diseases and conditions that afflict the elderly in India. Currently, Suresh is involved actively in building the research ecosystems in India and aspires to create more entrepreneurs and startups, thereby creating innovative thinkers in India. So, we present to you Dr. Suresh Pusala, and before we ask him to start his presentation, I would like to say that he is also an alumnus from our university, belonging to my batch, that is 1981 batch from College of Veterinary Science, Tirupati. And one more thing I would like to say is, he was kind enough when he was in Biocon BBRC that he had given 6 to 7 PG fellowship grants, each of 8 to 9,000 US dollars funding. And many of our PG students in the departments of anatomy, pharmacology, microbiology did their master's research with the help of the funding given by Dr. Suresh, around 9,000 US dollars for each student, spread over a period of 6-7 years. And he has given one such grant to the Department of Anatomy at College of Veterinary Science, Tirupati also. And he has donated a lot of individual cages and laboratory equipment. And with all his efforts and with all our efforts, we can convince our university and see that the first dedicated separate animal house building was built in the campus of N.T.R. College of Veterinary Science, Gannavaram. Earlier, the animal house was only a small part of a microbiology department or a pharmacology department. And he was kind enough that he also borne the complete transportation expenses for shifting of all the equipment from Bangalore to Gannavaram. So now I present to you Dr. Suresh Pusala. Thank you, Dr. Suresh Pusala, initially for accepting our invitation. And we'd be very glad that you give your presentation, which would benefit all. Over to you, Dr. Suresh Pusala.
Good morning, good afternoon to some of the people, and very good talk, Sudhakar. I'm sure I'll be crossing your roads at some point in Texas, especially if you're around Austin. Thank you very much, Kishore, for this invitation. I see many of my classmates also here. So I'm very happy to be associated with all of them because they all contributed to my learning and friendship. And they are very successful veterinarians, and I'm very proud of that.
Excuse me, sir. Your voice is not clear, sir.
Is it clear now?
It's
Sir,
a little resounding.
Vibrations are coming, sir.
How about now, Kishore?
Yeah, even now some vibrations are there. Some technical issue maybe.
Yeah, I don't know about that. I don't know how to solve that problem, but if you can bear with it, I think I can be closer to the mic and speak. Is it good now?
Sir, if you use the earphones, maybe that helps.
Yeah, that's a good solution. Right. Give me 1 second.
Yeah, please. So in the meantime, I'll take the opportunity to thank all the viewers who have joined. I think many would have preferred the YouTube link rather than the Zoom link. And globally, many people are watching through the YouTube live streaming. And we have passed on the message in many of the groups. And all the YouTube videos will be available in Anatomy Department YouTube channel, which can be viewed again and again. Thank you. Over to you, Suresh.
How about now? Are you able to hear?
Yeah, we are able to hear. Please continue. We will see.
Are you able to hear, Kishore?
Yeah.
Kishore, are you able to hear now?
Yeah, now it's better. Please. Yeah.
Okay, thank you very much. Sorry for the technical glitch. I think I have a weaker internet connection because they are trying to do some civil work around the apartment complex in Hyderabad. So sorry about that. And I will share my screen, Kishore.
Yeah, it's fine now. Your voice is good. Please go ahead. Share your screen. Maximize it and go ahead.
Yeah. Is it visible now, the screen?
No, not yet.
How about now?
No.
I shared the screen, Kishore.
No, we are only seeing you, not the screen.
I shared it. So why don't I send the PPT to you by email?
Yeah, better. That was what I was about to ask. I'll give you a number, my co-organizing secretary.
No, I will just
Yeah, please send it to me. Yeah, please send it to me. Please send it to me.
Okay, Kishore, let me see where your email address is now. Sorry for the delay, friends. I think we skipped some time because of Sudhakar also. So I think
no problem. We have enough time. Don't worry. Yes, we got your screen.
Okay, thank you, Kishore.
Yeah.
Okay, sorry for that small delay because there is a weak internet connection here and they just connected me back. So very good morning. I'm really motivated by the high energy that the previous speaker Sudhakar showed in his talk, and I was also excited to see the clinical cases, which I as a research veterinarian don't see that often. But nevertheless, here is a motivational speech from me, I would say, to motivate at least 10% of you to take up drug discovery for discovering new drugs, not only for veterinary diseases, but also for human diseases. And human diseases, of course, is very well funded and there are a lot of drug companies so that you have lots of opportunities. I am actually surprised that veterinarians are so successful in human drug discovery. And I didn't realize that while I was in the veterinary college, that we are going to be so important and so needful for the community of research and development. Kishore already gave a brief description about what I did over the last few years. Currently, I want to say that I have become an entrepreneur and a serial investor, investing in several small startup companies, especially founded by veterinarians. So that's one aspect of me. The second aspect is I purely work on discovering novel drugs for indications, which I call as unmet medical needs, like diseases that don't have sufficient cures or no cures. And my company, OncoSeek Bio in Hyderabad, actually is one such company that focuses on creating platforms for discovering new drugs. The second company I founded recently is called Acasta, and if you see the screen, I'm slowly moving towards north of Andhra, or the southern part of India, to a city called Vizag. It's a very nice city. And the ecosystem there is not as developed as in Hyderabad, but it has all the amenities to become a very big research institute, a research center. Especially with the generics.
Suresh, sorry, I mean, please yes? Put on the presentation mode. Maximize your screen. Presentation mode.
Yes. How about now?
Yeah, fine. Now, please go ahead. It's now nice.
Sure, yeah. So the second company is called Acasta Health Private Limited. In that one also, I am pursuing finding new treatments and for diseases. But here, actually, very exciting topic here is stem cells and growth factors that enhance our healthy aging paradigm. So that is where the focus is. So if you consider cancer, Alzheimer's, degeneration as some of the diseases of old age, I think that is where I am focusing. I've also become an advisor for a very novel, beautiful cancer research park that is coming on a very large land space in Vizag. That's called Vyas Cancer Research Park. And happy to convey that I'm also an adjunct professor at Geetham, Vizag, and they have a lot of ambitions to become part of Department of Biotechnology's selected research centers in Vizag, and I'm helping them establish that one. And like Kishore said, I'm on several committees, but the most important one would be the Association for Accreditation of Laboratory Animal Care International. And I'm the only council member from India. And I do a lot of site visits to centers that are establishing in vivo research programs. And I advise them as a council member and evaluate their programs. So that is briefly to tell that there is no limit if you want to do something, as long as your pursuit is towards R&D and discovering new drugs. There are a lot of opportunities, even within India. And the reason why I came back to India is to build that ecosystem in India, because I lived in US for 35 years, 25 years of work life, and 10 years of education. So I think this is very, very important for veterinarians to realize that at some point, the ecosystem that you build is going to be your legacy. Proud alumnus of Tirupati Veterinary College. I have put the college picture there, and also our temple town, Tirupati, the beautiful hills, which we are very well known for. From there, I moved on to the University of Maryland, very large campus, very good veterinary school, medical school, and I did my residency there. And in the Iowa State University, I got my PhD in veterinary immunology and pathology. Then moved on to Maryland and NIH. NIH, of course, is a premier research organization with lots of money and also support for doing research. So at NIH, I was chief of comparative medicine, where we had the luxury of handling many research programs. And I took over the aging research program, where I kind of came up with several publications that conveyed that there are several genes that get enhanced or excited or suppressed during the aging process. Having done that and published in Nature and many good journals, I moved back to India, Bangalore, through a pharmaceutical company, which is one of the largest, called Bristol Myers Squibb, BMS, and came to Bangalore and established this beautiful building called Bristol Myers Squibb Biocon Research Center. And that's a 450 member organization, and 5 of us moved from USA and hired everybody. And I hired almost close to 120 people for that organization. And if you look at BMS itself, it's a very big pioneer in the discovery of cancer medicines, and they had excellent approach, created novel biologics called Opdivo and Yervoy, and that drugs that actually treat, and these are humanized antibodies. So with that experience in animal research and in vivo research, I finally thought I should start my own company and come back to India. And I left BMS in 2017, moved back to Hyderabad, and the round flying saucer-like structure that you see is the University of Hyderabad's School of Life Sciences. It's a very beautiful building, and my company is located on the 3rd floor of the building in the Bionest. Now with Acasta Private Limited, that's coming up for regenerative medicine and also some of the unaddressed medical conditions of aging, which is Private Limited, housed in Vizag. And this is actually the view of the beach of Vizag from the laboratory office that I have at Vizag. So this is a very nice city, obviously one of the most beautiful cities in India. More importantly, the Geetham University establishment there is very well known for education, and they're also trying to get into R&D. And I support that kind of ecosystem. So bringing the university along with this company and associating with the Cancer Research Park, I think as really, really required combinations for establishing a research facility. So far I did not say anything about veterinary science per se, but here is where I want to segue into a very interesting topic on how veterinarians are involved in education and research. Of course, as veterinarians, we got trained in clinical aspects of veterinary medicine. We support microbiology and all the other paraclinical subjects, but I never realized that we can be involved way too much in human health. And this is what is something that students of veterinary science miss and completely focus on veterinary science, which is our primary goal. So even as a research veterinarian, I am here to convey that I actually spent a lot of time teaching veterinary science to scientists who are not veterinarians. So many scientists and doctors, they use lab animals in their research, but they don't understand the physiology, the anatomy, and the biology of animals. So we become a very integral part of that kind of scenario. So we are very, very important people when it comes to actually pursuing veterinary science from the perspective of providing support in research. So in postgraduate teaching, you also have pharmacology in our subjects, which is a very, very important subject. And I realized that when you get into drug discovery, the main subjects are physiology, pharmacology, anatomy, and medicine. These are the main subjects that will support you to really excel in research. So if you are thinking about research, these are the 4 subjects primarily. But of course, the other subjects are very, very important. But in research, these become very critical. In academic research like NIH or university, I began to understand the mechanisms of disease and health, but was not discovering anything special. So I was looking at the basic veterinary science as something for me to understand while at NIH. And you have a lot of resources to do that in a place like university, academia. You have the support of colleagues, you have all the departments in one umbrella. So it's very easy to do that. In industrial research, which some of you are thinking about, or which I eventually came into, the industry research part, the main focus is on the research aspect to make it a commercial translational product. So you have research, you have that knowledge, but you want to make it a product. So how do you make it a product is a very important part of industry research. So if you think you are a veterinarian, you understand physiology, pharmacology, medicine, and other subjects thoroughly, you're excited about research on human health or veterinary health, you first get trained in academics because you have all the basic requirements and then move into industry research. And one exciting thing about industry is it not only pays you really good, but the most important part is you have your signature. If you spend 10 years on a product that comes out, and you can come out and proudly say that you are a team member that created a medicine for this particular cancer or this particular disease. And that is the beauty of industry. And that is my biggest motivation to pursue veterinary science in an industry setup. So here, I think you can also participate in teaching and building the ecosystem here, veterinarians teaching school children in Tennessee, and also in preclinical where you handle lab animals. So one emphasis I would like to make is in the veterinary science, nobody in my veterinary program taught us how to really treat a lab animal, how to use a lab animal for research. That is something that we learned. Of course, we get to learn about dogs, cats, and domestic animals, but we failed to recognize the importance of lab animals. And that's something that really was interesting for me during my academic career in NIH. So for the undergraduates who are part of this program right now on this webinar, I would like to outline some of the things if you are confused on what we do as a veterinarian. Research veterinarian's role might be well behind the scenes, but you will still be a clinical veterinarian, and it is a very important job. So your clinical sense, clinical skills are very much needed even as a research veterinarian, because you'll be treating monkeys, cats, dogs, mice, rats, rabbits, guinea pigs, all are animals, but you learn how to treat them as a population instead of an individual animal. And also you will tend to understand what is the outcome because you are a clinical veterinarian. So you are much more well-placed in research as a clinical veterinarian. That's one. So if you think you're going to miss clinical veterinary role in research, you are wrong, because in research also you need clinical veterinarians. And while I was at the Maryland University teaching and also training for my postdoc, I actually treated baboons, monkeys, mice, rats. So it's very exciting area. So research veterinarians are also educators who train medical doctors and scientists. And you are standing right next to the physicians when you are discovering new drugs, and you try to let them understand what's the difference between this animal and human, and you get to see many things happen in the animal before it happens in the humans. So you can tell which one works and which may not work. And you contribute obviously to scientific publications, which is very, very important for your growth. Many veterinarians in research have contributed to West Nile disease, virus, mad cow disease. All these are new diseases that came in the last 20 years, but veterinarians played a huge role in treating these diseases. And then when you go to the veterinary roles in a lab animal setup, you're actually the first and foremost to see if the drug is safe or not in an animal. So if you inject something into the mouse, you'll be the first one to notice what happened in that mouse. Thereby, you can extrapolate to what will happen or what is more likely to happen in the human. So that is where it's a very critical phase. It's called translational science at that point, because you're taking it from what you're observing in the lab to the patient directly. So this is a very, very critical, and many doctors depend on your interpretation of either toxicity or safety or the efficacy of the drug. And that is what the research veterinarians, as toxicologists, as pathologists, as immunologists, do in their daily industry research job. Research veterinarians have been involved in identifying many diseases, many pathogens, many toxins, and as surgeons, they have become very, very important in finding material that is used for knee replacements, hip replacements, and organ transplantation. So now you can tell that it's not just drugs that you discover as a research veterinarian, but you also find medical devices like heart valves, hip replacements, titanium implants. So everything involves a research veterinarian studying those things in the animal and then telling which one will work. So there we have very good sheep model for joint diseases, and you have many, many dog models for hip replacement, and physicians use the help of the veterinarian to understand surgeries and practice them on pigs and dogs and sheep. So all these are very, very important roles that a research veterinarian plays. So that is about my introduction, and also something that I told Kishore that I will focus on veterinarians and probably market it in a way that you don't see when you're in the veterinary school what your role is in a research lab or in a industry or a drug discovery. But then there are several opportunities. So this talk emphasized that point up to this point. So if you're pursuing lab animal research or drug discovery research or medical device research, please do go and search for veterinarians in those areas. And we have very, very successful, highly successful people in all these areas. Now coming to a topic that is very relevant right now, because if you heard about a vaccine, I think we are all waiting for a vaccine. We don't know how fast it will come, but it is very, very much around the corner for corona or for COVID. But here is an image of respiratory syncytial virus vaccine research that has become very important over the last several years. And look at all the animals that have contributed to the discovery of just this one vaccine. Obviously in corona also, we are using mice and monkeys and chimpanzees and so on. But look at the animal models that have contributed. So we are all familiar with cow. They have been used for clinical disease modeling and vaccine development studies for subunit vaccines, not only for veterinary, but also for other applications. Of course, monkeys, non-human primates play a very important role for translating vaccine studies into the humans. Sheep has been a good model, and right now with ferret as a nasal respiratory model for coronavirus, one company in Australia has used ferrets exclusively to come up with a nasal inhalation or nasal spray that is effective against COVID virus. And I don't want to go into the in-depth of the research, but ferret has contributed. And we as veterinarians in the college never touch a ferret and never see a ferret even if you're in India. But in US, it's a very good model and accepted model in many, many research programs in discovery companies and universities. I don't want to expand on the rats and cats, but they have been widely used for drug development, small molecule development, therapeutic drugs, testing of vaccines, efficacy of the vaccines, preparing the doses or arriving at the dose that is needed. And this is all we have achieved just for vaccine. But if you name a disease, there is an animal model. So every disease has an animal model, and everybody has used an animal model to submit an FDA approval for a drug program and probably come out with a successful drug. So that's very important. And also very important to realize is out of the 124 Nobel laureates in medicine and physiology in the last several years, 94 Nobel laureates have actually used small animal model or a large animal model for their discovery for which they got the Nobel Prize. So this shows that there is a hidden jewel in research for veterinarians to play a significant role. And we are probably the best people to understand both animal and human, and that's the translation part. So let me segue a little bit into deeper science. I took great care not to go too much into the depth of the science. Kishore warned me that there could be undergrads and undergraduates who probably would get bored with that in-depth science, but I want to motivate them to understand simple topics. So I just took one topic, one disease topic today, not all the diseases like Alzheimer's, Parkinson's, and everything. So I just took tumor, cancer, which most of us would understand quite easily. okay? So normal cancer tissue on the left here tells that, okay, there's healthy cells, normal extracellular matrix, it's a beautiful connections between capillaries and blood vessels. And the tumor, when you go to the right side, now you have an abnormal cell population, and there is a leaky blood vessel and an ability for a tumor to go into the capillary. So this is very, very important to understand, because what changed from here to here is the cell population, the extracellular matrix, the permeability of the blood vessels, and transport mechanism. So now if you put all this together, then you have changed a normal healthy tissue into a cancerous tissue with a lot of physiological properties that have changed. So that is a very brief outline of what happens in cancer. Of course, it's much more complicated than that. Now, what I am planning to do, or I do for cancer research, and that is just one focus that our company does, is I want to create a very, very good relevant model of cancer that can be used for testing drugs using minimal animal numbers, because animals people use extensively. So we as veterinarians are very careful about how many we use, how we use, reducing the pain, replacing the animal, so on. So when we refine those processes, we quickly realize that the relevant model is still a human being for a human disease. So why are we using animals? Because they simulate physiology and life and biology of a human. So with that factor, I want to bring in my company an interface called what I call as organoids or spheroids. These are cells that are isolated from animals or humans and told to behave in a way that they simulate an organ in a petri dish or a tube. So now with that, we have cut down the animal numbers. We have a relevant organ model, and these cells can come from stem cells of humans, or it can come from normal organs of humans or cancerous cells of humans. So if there is, for example, if there is a lung cancer in a human, I actually have an association with Apollo Hospital, get the cells from the lung cancer and create an organoid model in the lab and test the drugs that can be effective for that lung cancer. So we have drug efficacy testing, toxicity, and screening of drugs by using a very, very sophisticated model that is directly from the human. Now you can correlate those with the animal studies and see that thereby reducing the numbers, but also enhancing the relevance of tissues that we use. So again, going into an expanded picture of what I just spoke about, because you need to understand this is just one area where veterinarians are very important. Even though this is in vitro, when it comes to understanding cancer and animal correlation and the organoid, you are in the best place to understand all of them. So you take the cells from the cancer or human embryonic stem cells, which we just briefly went to that from mesenchymal perspective. But here we have embryonic stem cells. We create them and we put them in nutrient media with novel growth factors, which are very, very novel. And there are hundreds of growth factors that are available to play with them. Not an easy process, but we create small floating organoids or organs from these stem cells and program it to behave like lung cell or kidney cell or a liver cell. So this can come from iPSCs, which is the pluripotent stem cells induced, and or from patients, from cancer or normal tissues, or from blood. So once you have that, just focusing on cancer, you create those organoids or spheroids and test your drugs on these organoids and look for changes like mitosis or normal appearance or toxic changes and so on. Now, I think that is 2 slides for in vitro that I focused, because too much of in vitro is not exciting for a veterinarian, because we had to eventually come back and tell how is an animal relevant to this. So now, here is a very big discovery that happened in the last 5 years. This is a mouse model that was created by the famous Jackson Laboratories in Maine, USA. It's northeast part of USA. And this is an NSG mouse model where you have knocked out many things like natural killer cells, B cells, T cells, immunodeficient. These mice are very immunodeficient. And you also have a deficiency of cytokines, which means you have created a mouse that is highly immune compromised. And when you have a highly immune compromised mouse, you can inject or implant anything into it and understand what is happening. So there are challenges, not easy to create, but this mouse is already created and available. It's very expensive. It costs around $200 to $400 per mouse. So it's a very expensive mouse model. But once you have this mouse model, you can put your tumors into this and then study the biology, give the drugs into this mouse and see what's happening with the tumor. So this is a mouse model. So this is a classic xenograft model, a nude mouse model, very similar to what we talked about. It's not as immune compromised as a NSG mouse, but here you see that you have implanted a tumor. It could be a breast cancer or kidney cancer or solid tumor under the skin. And now you screen many drugs on this mouse model. And in some time, you see that the response of the tumor to the drug is substantially significant. So this is a breast cancer study, a typical study, but this is simplifying a very, very complicated subject for you all. So this is just one aspect of what happens in research in industry. You handle these small animals, very, very small, like 25 to 30 gram mouse, and all the way to a large animal like a non-human primate or even sheep or cattle. So you have to have a broad range of expertise or experience. And it does take a lot for a veterinarian to understand population dynamics, because you're not treating one animal. You are treating a population of 8 mice per group in 20 groups. So 8 times 20. So you're talking suddenly about 100 to 200 mice in a population. So population dynamics is a very important aspect of research veterinarian. So don't ignore population genetics or population statistics, which becomes very integral part. Having said that, now just to summarize what I said, okay, so we just realized there are many opportunities for veterinarians. They can be a clinical veterinarian, which is of utmost importance, and we can practice, and which is what we study for. But then if you deviate a little bit more and get more excited about academics, you can go into NIH or universities to teach and also participate in research and do publications. But when you stretch it a little bit far, you realize that you can teach doctors, teach scientists in research to understand life, biology, physiology, because you are in the best position to do that. And when you go into research atmosphere in an industry, then you actually can come out with a product that can translate into a medicine for human diseases. So this model, I'm just trying to collect the dots here. It's a very severely immune compromised mouse model has been used, NSG. The NCG is the other name from a different company. Both have severe immune compromise. So you take the tumor from the patient, you sample that, you mince it, and you passage that, transplant it into the mouse. We now have a humanized mouse that has a human tumor in a mouse. Now we test the drugs on this mouse, and now the tumor is gone. So this is not as simple, but this is what we are at the interface of this particular segment of taking the tumor, putting it to the animal, understanding the physiology, finding the drug, and then telling the doctors and research companies that these therapies are very effective for humans because they were very effective in the animals. So that is called translational medicine. And that is probably the most exciting part of my career, is to discover drugs using in vitro platforms like organoids in my current company, to using animal models to develop drugs or screen drugs and identify drugs. And this is what industry veterinarian does, in contrast to clinical veterinarian, which is very, very exciting because you have new case every single day. You are excited about diagnosis. You have to be very, very inquisitive, creative, and also innovative to find what that disease is. So you are very much investigational. And this is very similar here because you're looking at what happens to the cells, what happens to the antibodies, what happens to the disease, the tumor, and symptoms, signs, and so on. So this is the exciting part of being a veterinarian. So I have, I'm sure I'm expecting a lot of questions. I kept this presentation brief and succinct for all of you to understand. This slide is telling you that we play a very big part in vitro and in vivo research. We have new technologies like cells and microarrays and microfluidics coming into play. Now there is another new technology called 3D printing, where we understand how a human or mouse liver looks like. We can print it, and then you can play multiple roles as for India R&D to innovate in vitro and in vivo space. And we as veterinarians can play a very big role. We as veterinarians can play a very big role in that translational space called translational medicine in research. I also want to convey that the importance of this talk is for you to give a glimpse of what I did, but more importantly, there are very, very successful veterinarians. Within our batch, we have 2 entrepreneurs who recently launched drugs into the market, are working on cancers or working on chronic disease, and they could take something, veterinary science, all the way to bringing out a drug into the market, or potential drug into the market in the next 4 or 5 years. And I am planning to do that in India, because I think in India, the innovation space is not occupied. We find quick solutions by way of small innovations. We have not discovered a drug on our own until now, in spite of so much of herbal, Ayurvedic, small molecule, veterinary medicine and experience and skills. We are highly skilled. We just have to create the ecosystem. So in the next 10 years, I'm anticipating that veterinarians in India will also discover drug, and I am working towards that. I'm going to create platforms for those kinds of veterinarians. I also want to state that I do offer internships and provide employment as an entrepreneur for several people. I guide many people to either go to US or come back to India, both ways. And the ecosystem in both places are very ripe, very, as you see in the success of Sudhakar and others as clinical veterinarians in USA, and the success of research veterinarians from my own class and from my seniors in USA. I want to state that India has that potential. I took the bold step of leaving everything behind in US and then coming to India. And I'm very, very happy to say that I'm able to support many veterinary colleges and many friends to create such kind of ecosystem in lab animal, in vitro, in vivo space to create an R&D establishment. So likewise, I think the main thing that we lack as veterinarians is the business aspect of it. As a clinical veterinarian, I think you have to be on top of your business. You had many questions about how to manage money, how to manage the economy, how to balance the books, how to be innovative in saving money, bootstrapping, how to spend, how to face legal, how to incorporate a company, how to look at the books and make sure that you are putting your money in the right space, and how to become a successful entrepreneur and make wealth, not only for yourself, but also for, in general, for the country. And also the most important thing is to find a cure for the unmet medical needs that we have. So I'm very excited about what we are doing in India. I'm very excited that we are veterinarians. And I thank the organizers of this event, especially the students who are listening to this conversation. Please aspire to be a veterinarian first, and then a researcher next, and build a very bright future and become an entrepreneur. It's not everyone's game, but I think if you have interest, I can coach, and you have many resources for becoming very, very successful and discovering new drugs. Thank you very much.
Thank you, Dr. Suresh Kusala. It was really a very good insights into aspects in which first year BVSC student can think of progressing to the level where you have reached. And it's, I think, very beneficial to all our current students and the fresh alumni who can think in those lines. And Apart from what you have said, I would like you to again highlight of many of our classmates like Gopal Krishna, Nagaraj, Balaji, Deepak, Pratap Reddy, Madhav, and all who are all over to the US right after our post graduation. And the recent pursuits of either Gopal Krishna or Madhav will give good insights on what they were doing. So I would like you to just brief on those aspects. Just about our classmates, nearly a dozen of them, Vasundhara, Chari, so many of them. Chari is in Canada in clinical practice. So just brief those aspects to our students and fresh alumni, young alumni, please.
Sure. So when I think it's a very good idea, Kishore, I just referred to both of them as successful models. And I mentioned the name CKD, chronic kidney disease is the area where Madhav worked in his last stint as an entrepreneur himself, as a CSO of a startup company that they started. So he focused on one disease, and as a scientific officer in that company, he successfully created a promising molecule, and that company was acquired by uh, a very, very large company, and that valued this company at $2 billion. So there is a lot of the aspect that we forget or we are not too excited about is the money part of it. If you're so much into research and come up with a nice molecule, there is so much money also in this business. But then you can reinvest that money, reprogram that money for teaching, training, and finding new cures. So that's about Madhav, who worked who was our classmate and who went all the way from here and became successful as an entrepreneur and launched it. And of course, big successful story also is about Gopal Krishna, who is my very dear close friend. And we, all of us, believe me, when we went to US, we were talking about going to US right from the last 2 years of my veterinary school. All we were focusing on, write the GRE, take the TOEFL, go to US and get into research programs, get a master's admission, PhD. So those are the stepping stones. We all did that, and we are here today to speak to students to motivate them, right? So Gopal Krishna actually worked on a very good cancer project in his previous company after his post-graduation from Florida in immunology. And he was working for a very large company called Insight. Then he had a good discovery for hematologic tumors in that company as a senior scientist or a vice president. Then he started his own company called Prelude Therapeutics, and he launched it in 4 years on the New York Stock Exchange. And he has a molecule that shows promise for curing several types of cancers. And that has been sold in the market as a very good idea, and which people invest. When you go to investors, there is huge diligence and everything is looked at under the microscope. So if you pass that, then that means that you have value in your product. And he just raised a lot of money for furthering his research in that program. So that's Gopal Krishna. Now coming to Pratap Reddy, he was in a very, very different entrepreneurial area of feed technology, and he created very, very novel combinations of nutritional supplements, or what you call as absorbable ingredients into the feed. He created analytics to understand them, and he acquired a business in New York, and now is supplying novel formulations that can be feed additives throughout USA, but he's also started doing that in India, and he supports our analytical program in the College of Veterinary Science, Tirupati, where he established a lab by himself. So these are contributions. And of course, Deepak is in a very large company in the bioinformatics space. He is with Sanofi in Boston, and he is head of bioinformatics for that. And he came a long way. If you look at Deepak went through a PhD program and was at the company for a long time in GSK. And he took that experience and he became now head of bioinformatics at Sanofi, very large. It's a huge feather in our caps. We can talk about all the veterinary classmates who are in USA, but definitely the person to look for is also Nagraj. He is in academics. He is very, very highly energized and spirited. He works on the area of muscular dystrophy, Duchenne's muscular dystrophy, and he has created an animal model long time back. He continues to be a professor and head in a pharmacology department in Pennsylvania. And he also has a startup company. So there is a lot more coming out of our classmates, Kishore. I'm sure I'm forgetting quite a few, but everybody is successful.
I will,
and I am actually finding many successful veterinarians even in India.
Nice, Suresh. I'll add to that list.
Kishore.
Yeah, I'll add to that list. We have our classmate, Dr. Ramesh, who is the professor of microbiology in Texas A&M University. So he is doing well. And when I came to California, I met our other classmate, Balaji. He was doing very well. And in another visit to my son's place in California, I met our senior Uday Shankar, 79 batch. He was also doing very well. So we have our own classmate, Lady Vet Vasundhara, who did very well, who is doing very well. And we have our own classmate Chari, who is in Canada, who is a practitioner like Sudhakar Patabhi. He is doing very well. So like that, there are a host of many other people. And let me tell you frankly that when I wanted to host this international webinar series, it is not that the academicians benefit, and I discussed with Dr. Ravi, our associate dean, that we need to see and we need to strengthen our alumni, and we need to show to our alumni that there are many alumni who are in various capacities across the globe. And mind you, I think many of those who are listening to that will never imagine that such big things that we all spoke about of so many capacities and listing on NASDAQ for Dr. Gopal Krishna, and being an entrepreneur, Pratap Reddy in feed manufacturing sector, they would see that these are all veterinarians and from our own alumni. So that was what I wanted to focus and see, that our alumni benefit scientifically, and our alumni also benefit from all these things, coming to know of what position you can reach. So that was another aspect. And let me just deviate. Dr. Pradeep Kumar, yeah, I'm seeing you on the screen. So let me introduce you, Dr. Pradeep Kumar Yadav, who is from All India Institute of Medical Sciences, New Delhi. And he is the lab in charge of AWMS New Delhi. And recently he has been elected at the Veterinary Council of India member also. Dr. Pradeep Kumar, I invite you to this and please unmute yourself and address our viewers. We would feel very happy that the lab annual in charge of All India Institute of Medical Sciences and our VCI member is addressing the viewers. Dr. Pradeep Kumar, over to you.
Hello.
Yeah, we are
Good
able
afternoon.
to hear.
I am Dr. Pradeep. I am Pradeep Kumar Yadav. I am working as senior veterinary officer, All India Medical Sciences. I will look after the laboratory animal rodents and primates. I am a member of Veterinary Council of India. I will full support to you all the veterinarians in the field to develop the research field, particularly all the position of veterinarian like NPA, DACP, like this. I will support all the veterinarian for the research purpose, and we constitute the VCI within a week after any problem of the veterinarian in India. I will definitely solve all the support to all the veterinarians. Thank you.
Thank you, Dr. Pradeep Kumar, representing the All India Institute of Medical Sciences, New Delhi. And we would like to quote some more examples. I think Suresh Pusara also knows about Shankar Narayanan. He was our veterinarian, an MVSc and PhD in pharmacology and toxicology. And he was heading some medical institutes. I think he was in AMS or some other institute, Dr. Shantar Nair. He was the CEO of that CRO in Hyderabad. So like that, sky is the limit for veterinarians. That is the other angle that we would want to focus for the present students and for the fresh alumni. Now,
Actually, Kishore, I would like to add a few. I would like to add a few things. It's
please.
very good to see Dr. P.K. Yadav. I'm surprised that you attended my webinar. I'm thankful for that, Yadavji. You're on the VCI and you're an active member of LASA. You're a good friend of me. I was vice president of LASA for quite some time, and I plan to work with you very closely on developing laboratory animal research, especially for drug discovery. Needless to say, I also want to compliment some of the innovative leaders who are coming up within our classmate in India. I would say, I mean, definitely not to forget Jawahar Reddy, who is IAS and our classmate who has promoted and helped everyone. Apart from science and administration, he has excelled in everything, right? He is extremely helpful to the veterinarians. More importantly, we also have a new veterinary college coming up, and my classmate, proud to say, Venkat Naidu is going to, he has pioneered in establishing that, and he is going to probably be the pioneer in bringing veterinary science to the north coastal region of Andhra. So very happy to say that. And apart from that, we have many classmates, Hanumant Rao, MBL, Nasim Raju, everybody leading the departments in the husbandry. I'm just identifying one or two because we are a class of 100 people or 96 people. And we have many in the faculty too. Having said that, let me tell Ramesh Vemulapalli, he's Ramesh, our classmate, Kishore. He's considered an expert on brucella. And I have introduced Ramesh to the Department of Biotechnology 10 years ago. I made him an expert panel member on DBT. And he came and gave a very nice talk in NIAB. And Indian government actually talks to him through DBT for any potential vaccine for brucella or potential bioterrorism that could be coming in the future. So we are going much beyond research. I think we are actually talking about us inventing, discovering vaccines, drugs, and now preventing, protecting us from bioterrorism. And SARS-CoV said that we have to be prepared for this, and veterinarians are very critical. So I think we are not only just contributing to research, academia, clinical, but we are probably going to save the mankind from many acts in the future. So this is what we are much bigger than what we talk about outside. We are definitely contributing quite a bit to veterinary science and human health.
Yeah, thank you, Suresh. I think now I request my co-organizing secretary, Dr. Iqbal Haider, to please go ahead with the question and answer session. Over to Iqbal.
Thank you. Thank you very much, sir, for a very nice and interesting talk. So I have a few questions. You were talking about the drug discovery in India and about the herbal products which are coming up, and we are restricted to only that. So how do you actually think the linkage between the prospects of the herbal components and how we go about bioprospecting of the active ingredients which could be useful for the future addressing of diseases in human beings?
Okay, so this is an exciting topic. The expert, however, is one of our classmates who is the professor and head of pharmacology, Dr. G. Srinivas Rao. We call him Kavi. He's also an excellent poet. He's an expert. He is on my advisory committee, not a committee, but he's an advisor, just like Kishore and everybody is an advisor for me. Kavi or Srinivas Rao is an advisor. And he actually is a stalwart he's from IVRI. He did his PhD there. So the herbal products actually have a lot of value in veterinary medicine. We all know that. We have used herbal products in a very broad way as a very active ingredient without knowing which is the active molecule in it. But now the AYUSH program lets us come out with herbal products. Even the FASAI as a nutraceutical lets us come up with herbal products very fast. In fact, one of our veterinarians recently, who is also advising me on something, is based in Hyderabad, was our junior, Adinarayan Reddy. He came up with Quercetin, a tablet that will boost the immune response, increase the uptake. It's a zinc ionophore, and it's in the market. It's available on Amazon. So three things. One is herbal medicines have to fall into the main line of active medicines that are getting promoted and regulated. Once that recognition is given, I think herbal medicines will, scientists will actually believe and work, because this is our tradition. We have thousands of years of expertise in Ayurveda from India, right? So we have to find that kind of money and support from the government, which the government is taking up seriously now. And FSI, DBT, ICMR, Ayush, all of them put together, they're coming up with a consortium or a plan to put herbal medicines in the mainstream. For that, we need to find active ingredients, do regular toxicology, safety, pharmacology screenings, and come up with doses and everything meticulously. That's where the value is. What's happening here, Tulsi or Giloy as something that has an unknown active ingredient, or say that, okay, aloe vera has several active ingredients, and then we try to market it in a very broad perspective. So we have to come up with novel scientific ways and streamline the process, discover the active ingredients by chromatography, preclinical evaluation, and then market it, so that the importance of herbal medicines is very well known. And veterinarians are that interface, trying to do the cutting edge preclinical sciences with herbal medicines for using in human medicine.
Okay, thank you, sir. So another question is that how far actually this in silico drug discovery or drug design will help in, addressing the drugs which are short, I mean, in the current scenario for upcoming diseases and challenging diseases?
Okay, in silico drug discovery, I think is the cutting edge way of discovering new drugs. This actually uses molecular modeling, computational dynamics, 3D printing, and also artificial intelligence. All four of these put together, you would try to call it as in silico drug discovery process. Here, you need very strong background and knowledge as a chemist, as a biologist. You need to be very, very, very strongly bound to that. And then on top of it, you need to have people or yourself learn new skills, which includes computational drug design or modeling of drugs, where you talk about ligands, receptors, molecules that go and bind, the lock and key mechanisms, how they interlock, how much avidity, strength is there when they lock each other. So you need a lot of knowledge and base and equipment to understand this. In large drug companies and large institutes like NIH, in silico drug design is an integral part of drug discovery. So in my own company, I have an in silico bioinformatics guy who will screen several peptides based on structures and closeness to an active molecule and try to tell that this particular molecule can bind and create a similar effect. And that is prediction. But now you have to actually do the test, actually dock the molecule, take the molecular chromatographic or scintillating microscopic images and readings, and then come up with a 3D structure. And then now you go forward and see the actual. So nothing is designed and taken to human. After the design also, the most important part of discovering a drug is still the activity, the toxicology, the safety, and the dose response, which still needs animals and in vitro methods. So in silico to human has in between many things, but in silico makes it really fast to identify a drug based on structure and docking and charges and electrons and all those things. So physical dynamics is very important, and it's becoming very, very important right now.
Okay, sir. One more thing is that there is actually rediscovery of different effects for the existing drugs. For example, even for COVID, they are telling that this drug, which was effective for parasites, is now effective for the viruses. So how far do you think that this rediscovery is, at what stage it is now and what stage it is going to be when we are talking about rediscovery of the existing drugs?
Okay, so I want to phrase it as repurposing of the drugs. So what's happening is these drugs are already discovered. In fact, ivermectin is what you were referring to. This was actually discovered long ago for river blindness and so on, and now it's effective against based on zinc ionophore mechanisms and so on. So now that is one example for COVID, but there are several drugs screening for COVID because there is a need. Having said that, there are at least 500 drugs being screened by my own company on my in vitro platform organoids, and these are low-hanging fruits. These are the fruits that are low-hanging because These drugs are already in the market. They have passed the safety, efficacy, toxicology paradigms. Now you're looking for a new indication, which means that you can actually use an existing drug, because drug discovery takes 10 to 15 years and it will cost $1.3 billion to discover a new drug. But now with all the 1,000 drugs that are available, if you can reprogram, repurpose, that is where hydroxychloroquine or zinc or many drugs came into picture for the COVID. So repurposing is a very active component of drug discovery research. It doesn't sound innovative because the drug is already discovered, but if you can use something that is available for a special different purpose, I consider that still as innovation and being very smart about your innovation, because it will cut down the time of discovering a new drug, solve the problem much quicker than original drug discovery, and probably is very important, especially in situations like pandemics and zoonotic and sudden bioterrorism events and so on. So our company, and I think most of the drug companies, are focusing on repurposing of drugs big time.
Okay, sir. So just one last question, sir. You were talking about the iPS cells and organoids. So now actually, I think when we talk about iPS cells, we have this naive and primed iPS cells, which is recently coming up, the concept of naive iPS cells. Or do you think there is a difference in the formation of organoids when we talk about naive and also primed iPS cells? Because already primed iPS cells are towards the stage of differentiation, and how effective are these actual naive iPS cells in this organoid formation and for the drug research?
Yeah, so I think Sudhakar is an expert on stem cells, so he can probably interject and tell if he wants to say something on the basic science of it. But let me tell you, the stem cell programming to become a host cell of a primary cell of a particular kind is not easy, number one. If it's a naive stem cell, it's a multipotential, there's a difference between that and a programmed cell, which you call it as a primary stem cell, that is not naive anymore, because a primary cell which is not naive anymore has already taken a path of differentiating into a particular cell type. So when we took the stem cell, we would like to take some stem cells from fluids or amniotic or allantoic fluids or mesenchymal regions or bone marrow, and take that and put some growth factors which are very specific. For instance, now I have a COVID, USA COVID grant from a company that we got recently, one from BIRAC DBT and one from US government. In the US government grant, what we are trying to tell them is what we want to create iPSC derived lung cells that not only look like lung epithelial type 2 pneumocyte, but also have a subset of population that looks like bronchiolar lining cells, ciliated or non-ciliated bronchiolar epithelial cells. Now we want to create an organoid out of an iPSC that has two subsets, where we need a naive cell to begin with, but also program it to become two different cell types. And this is challenging, but we are working on it. We use growth factors like fibronectins, noggins, several interleukins, very exciting field, very challenging field. And we are close to getting that to look like a lung organ itself out of iPSC. So naive cells are difficult to handle. Primed cells are easy to handle, but naive cells have great potential if you have expert scientists. But primary cells, primed cells are much more easier if you're not. Still, it needs a lot of expertise. But I'm telling you, we are creating this organoid out of a stem cell that looks like lung epithelial cells. And the US grant is expecting us to screen a novel molecule that we are coming up with on this platform and repurpose many drugs. So we are tying up with IIT Gauhati or NIPER or some other drug universities, which will send those molecules onto this organoid platform and see. We infect it with COVID virus and screen it with these drugs and see what happens. So they can be stopping the binding, they can be stopping the replication, or they can be stopping the release. So we are looking at many things, but definitely your question about stem cell is a very challenging topic, not easy. We prefer a primary cell, tumor cell from a patient than a stem cell from a embryo, because it takes a lot more time for stem cells to be primed to become primary lung cells or liver cells.
Thank you very much, sir. Thank you very much for answering the questions. I would like to hand over the charge to the organizing secretary, Kishore, sir.
Yeah, thank you, Dr. Iqbal. And Dr. Suresh Kosala, I think I would again request you to throw some light on the international conference that you are going to organize on 19th and 20th of November this year. Dr. Suresh Pusala. Dr. Suresh.
Kishore, I just want to thank Sudhakar for staying up so late and listening to my talk, number one. I think he has motivated all the veterinarians to pursue very, very exciting clinical veterinary science. And I want to thank you for organizing such a wonderful webinar, first webinar. All the best for your future. And I want to thank all my classmates. Naidu has to mute.
Thank you, Suresh, for those kind words.
Thank you, Naidu. Thank you, Kishore.
Dr. Suresh, please throw some light on the inter conference on 3 Rs that you are organizing on November 19th and 20th in India.
Okay, so apart from doing science and what we do as laboratory animal scientists, is I want to promote 3 Rs, which is reduce the number of animal use, refine the practices so that it is less painful, and also replace the animals with nice models. So at the end of the day, as veterinarians, we have to make sure that we don't make the animals suffer for too long. I think in the laboratory animal science, too many animals are being used. We can control that and still make meaningful contributions. So that is where we are coming from. So we are organizing a 3 Rs conference in Hyderabad webinar. Kishore is part of that. And I have invited 20 international speakers, and on the 19th and 20th of November. But also after that, it will be available on YouTube, a very large global veterinary conference. We're expecting at least 1,000 people to watch it, if not live, in the future. So we are promoting good laboratory animal care because we are veterinarians and we are responsible. And I promote that on behalf of the laboratory animal science. As member of LASA, I want to promote 3 Rs. And I want to start a teaching training institute for laboratory animals at the University of Hyderabad. We have made some inroads and we are going to launch that program also during this conference. And that's what it is about. And Kishore is part of that and he's helping me in that.
Yeah, thank you, Dr. Suresh. Now, let us hope the scientific part is over. What is the advice that you give to the budding veterinarians?
Well, Kishore, I think the budding veterinarians have the total freedom to make choices that can make them really, really excited veterinarians. The budding veterinarians should keep all their options open, go and do a lot of search. One major thing that they can do is internet connectivity is very good for people to go Google and find out successful people and connect with. If he or she wants to, I also see that a lot of women veterinarians are getting into the research veterinary science right now. And I want a big network of people in veterinary science and pick their areas of interest. And with that networking, connect with experts or successful people. Like for instance, if he wants to be a clinical veterinarian and wants to succeed, there's so much they can learn from people like our Chari or Sudhakar. And if you want to get into research, we are always open. So I think a budding veterinarian should keep the options open, read a lot of literature and look what excites them and get a lot of advice from seniors and probably make an effort to meet people like us. We still have a lot of learning to do. When I talk to new veterinarians, I learn a lot, Kishore. Their questions excite me even now. So I think budding veterinarians, please keep your options open, get excited, and you be proud that you're a veterinarian because this is the profession that is going to save the mankind and solve many, many human problems. And you're at the cutting edge of that clinically or research-wise.
Thank you, Dr. Suresh Pusala. And before we wind up on the session, I'll make it open for any of the viewers to please unmute yourself and interact. Maybe the co-organizing secretaries from my college, please introduce yourself. And any other viewer, please unmute yourself and interact one after the other. If you find someone who has already started, just wait for your turn. After that, we'll wind up. Dr. MVL and Raju, Dr. Venkat Naidu. Anybody, it's open for all.
I shared the screen of the conference that is coming up and all the speakers.
Yeah, nice banner or logo.
Yeah.
So is anyone up there who wants to interact?
I think they have to unmute and ask the question. I see somebody trying to ask.
Yeah, anybody is there, please unmute yourself and interact. In any regard. Dr. MVL and Raju is seen here. Could you please?
Nasim Raju, please unmute and say something. Yes, Nasim Raju. Yes, Raju.
Yeah, good afternoon, all of you. So nice, Dr. Kishore and all your team for organizing this wonderful event. And definitely it is going to motivate the younger budding veterinarians. And the great experiences of all the people like Dr. Suresh, our classmate, and many others. No, they are going to help the veterinarians in shaping their future careers. Because a lot of opportunities, we still remember when we joined for our BVSC those days in 80s. So the avenues were very, very limited, or we are not really exposed to all these kind of avenues. And I take the credit like our batch was the first batch, perhaps where we had people into different avenues of our own veterinary profession. Like people are there in the core clinical practice, and some people like me, we have come to the Agricultural Research Service, ARS, and Suresh and Gopal Krishna and many more. They have gone for higher education there in the West, and now they are the successful models for all the veterinarians. And some have even gone into the banking sector and all those things. So I thank you and all the organizers for organizing this event, and also for the wonderful lecture of Dr. Suresh and the previous speaker, Dr. Sudhakar also. And to the veterinarians, like I also, from my own area, like Agricultural Research Service, I also advise them, you pursue this career also. It's a wonderful career. Agricultural Research Service, the ASRB, Agricultural Scientist Recruitment Board, conducts the examination, not only this national eligibility test, but also for the recruitment of the scientists into ARS. So this is also a wonderful career. So you can do great quality of research into production as well as clinical and paraclinical areas. Of late, we find, like in those earlier days, we used to find a lot of people from our own colleges coming to this ARS service, but of late, not many are coming into this. Please take up this also. And you keep watching this ASRB website, and whenever there is an advertisement, please do apply and then take up this career also. That's my advice to the budding veterinarians. And again, at the end, I thank Dr. Kishore and all your team for organizing this wonderful event. Thank you very much.
Thank you, Dr. Raju. I need to make a mention of my team, as many of you were mentioning. We, the organizing secretary, I have roped in very good faculty who could be my co-organizing secretary. You can see on the screen V.V. Harikrishna N. He is associate professor in surgery in our college. And you must have seen Dr. K. Sudhakar. He is assistant professor in the Department of Animal Genetics. And Dr. M.P.S. Tomar, you are seeing, he is assistant professor in the Department of Anatomy. And Dr. Iqbal Haidar, you have seen, who organized the question and answer session. He is assistant professor in physiology. Recently, he completed his PhD from Germany and returned back to this college. So we as an organizing team under the leadership of Chairman Dr. A. Ravi, we have done a very good job, and Dr. A. Ravi sir has given us a free hand in this regard. So we were a little hesitant that we should have every speaker with an international tinge. I should stay abroad, studied abroad, worked abroad, brief period or long period, anything, and a varied number of topics, and all should suit the budding veterinarians. So as I read out the list for 13th and 20th, I have already finalized the list day wise and date wise, communicated with each of the speakers, Singapore, New Zealand, many others from US returned, varied topics. So I think this would be a very good interactive one on 13th and 20th also. I see Dr. Karunanidhi sir. Sir, are you still there? Karunanidhi sir, he is our teacher. Karunanidhi sir?
I think he has left, sir.
No, sir is there.
Sir has chatted also. He has put some in the chat box.
No, sir is there, sir.
Sir with his sir with age of 70 plus is such an active professor, retired. He was the member board of management. I think he must have left. So he is such good at student activities also in all the areas. He was our teacher. And anybody else from across the different states of India would like to interact, please unmute yourself and interact. We want all your interactions for the benefit of our students and alumni. We'll be winding up in another 5-10 minutes from now, less than that. So we open up the opportunity to any viewer. It is open to any viewer. So, okay. So, Dr. Ravi sir, are you online?
Yes. Hello, Dr. Kishore.
Sir, yeah, please, sir, please interact, sir.
Yes, I think we had a very good beginning for this international webinar series. I would call two wise men, because knowledge and practice becomes wisdom. We had two wise men with us today. Their knowledge and experience should definitely motivate our students as well as the alumni. And one question to Dr. Suresh is, normally we send our students to IVRI or CCMB for some of the training programs on virus handling techniques or cell culture. Do you have any such facility so that we can send to our students to your lab as of now?
Yes, sir. Thank you very much, Ravi, sir. I think it's very nice to get a question from you. Very happy to answer that. So the program that we have is, we take in interns. We do support interns. So we have 3 students every semester coming from several places within Hyderabad. They prefer to be here and learn it. We teach them in vitro and in vivo handling techniques. We have a vivarium in the University of Hyderabad with small animals, where I actually have the permission and I'm getting them a skill development program. So we can do all that. We do take interns. Some of our interns eventually take up employment in the industry. We promote that. And I frequently tell the TV81 batch on our website if we have openings, and we have hired 2 people also. Our requirement is for somebody with pharmacology, microbiology experience, with a little bit of knowledge about physiology and biology and cell culture experience. Having said that, I have trained close to 18 people in the last 1 year. So we do promote it. So we do promote it, and please do send anybody interested in learning something, please do send them, send their application, and we will be happy to entertain them for 15 days to 1 month in our lab. And it's a free internship for us, for them. It's an opportunity for them. Thank you, sir.
Do you have any schedule for that? So that normally the CCMB, they have some
No, sir, no
schedules.
schedule, sir, no schedule.
Okay.
No, sir, they are large institutes and they have schedules. We take in as and when they are ready and when they come. What I have is, I have a large lab, I have space, and we have central facilities that offer trainings in the university, and I have access to all of them. Anytime they are free, they can come. So what happens is usually the children of my friends who want to take up biotechnology masters or go into PhD program, they want to see, they want to build their resume. So I had few people like that, mostly children of our classmates or friends. And some of them want to pursue medicine. They want to see how it is to do this. Because in US, children would like to have experience handling something in a lab as a resume to build the resume or CV to get admission into medicine. So 2 or 3 students from USA, Chicago or someplace like that, they came and worked with me for 3 months.
Very nice.
Got a nice letter from me, and they were successful in getting medicine admission. So there are internships like that. People who want to try, if they're interested in research, they can come and try it. We don't have any schedule, so they can come anytime they want.
Hello.
We don't take more than 6 at a time. We don't take more than 6 at a time. So if the schedule permits, we'll take them.
Okay. Thank you. Thank you. Now it seems Dr. Karnazhi sir is available. Hello, sir.
Hello.
He's on mute. He's on mute.
Dr. Karunanidhi sir, you are online. Dr. Karunanidhi sir. Okay. In the meantime, you are seeing this screen of mine. You can see my colleague Dr. Sudhakar. When I introduced all the other organizing committee members, he wasn't there. Now he is with me, sharing my screen. He is Dr. Sudhakar, assistant professor in animal genetics and breeding. So he is also part of the team as a co-organizing secretary. And our collective efforts have turned out to be fruitful. So everything is set for the 13th and 20th. And we have planned 3 speakers on each day on October 13th and October 20th. So this being the inaugural one, we scheduled it only for 2 speakers. So they will also be very interesting topics, as I have already read out. So please spread the message and see all benefit from this. Karunanidhi sir, are you available?
Yes, sir.
Okay, maybe not.
Speaking.
Okay, then last opportunity for any viewer to interact. Otherwise, we'll wind up. I have asked twice, and the last opportunity. Yeah, Sudhakar Rao wants to tell something. Please unmute yourself and speak.
But I thought I already unmuted. Sorry. Thank you, sir. It's very fascinating and to know a lot of people and all great. So, so I'm just signing off. That's why I'm.
Okay, thank you. Thank you.
Thank you.
Thank you very much. Thank you very much for your involvement.
Thanks a lot. We kept you awake midnight in Texas.
No problem, sir.
Okay.
I'm really happy to know Suresh sir. Actually, I'm also did some research on stem cell. So I thought maybe, I don't know how far we are in India, but here we are doing some stem cell infusions, IV in the clinical setup.
Yeah.
But we are in very beginning stage in ES. So, but a lot of hurdles, like FDA hurdles, we cannot do a lot of work here. But I'm really interested that you are doing that iPSC, pluripotent stem cells and some models. at least someday something will come into the field.
Thank you, sir.
Thank you.
Thank you.
So shall we call it a day?
Yes.
Ravi sir?
Yes, yes. I once again thank both the speakers, the organizers, particularly Dr. Kishore and his team, and all the participants, and hope the next webinar will be as fruitful as this one. Thank you all for your good memories. Thank you.
Thank you very much, sir.
Thank you all. We sign off. Thank you. Thank you all the organizing team members for this wonderful first day of the international webinar.
Thank you, sir.
Thank you all viewers. Thank you.